Well, good morning, everybody. Super excited to have you all here today. This is the 2022 Wisconsin Enrollment Conference. It's always a big event, and we're just so pleased to have so many of you with us. Before we get started on our first session of this year's conference series, of course, I wanted to just give some welcome and introductory remarks and just some information, a lot of which you, if you've been watching the beautiful scrolling slideshow that our very own Mike Moriarty has prepared, lots of really good information there. And I'm going to recap some of that, especially for you that those of you who have just joined us, but also just because it's so important. This is our largest attendance yet. Of all the years of doing this, we have, as of last count, 365 registrants for this conference, which is just fantastic. We're so pleased that we can reach and connect with all of you and bring this really important, critical information to you and just be in this community. We're so happy that it's growing, and we hope that it continues to grow. This year, we also have 75 who have registered to be pre-licensed as part of this conference. Those are folks that are newly doing enrollment assistance, being either a certified application counselor or a navigator. So that's super exciting. They've already started. They started 2 weeks ago now with some of those pre-licensing sessions, and they're continuing. So welcome. Thank you for joining us again. We have 179 who are also getting their continuing education credits. We know that this conference is a really critical piece in helping you to achieve your state continuing education crediting and be able to continue to provide that assistance every year. And then in terms of the folks who have joined our conference in years past, we have 113 who have never joined, so welcome. Thank you for being here. And then 117 who have come for 1 to 3 years, 53 who have come from 4 to 7 years, and then every year is 43 people. That's amazing. We have 70 towns and cities in Wisconsin represented, and 145 agencies across the state. So that just shows you how many different stakeholders there are in this work. I probably didn't need to tell you that, though. It's pretty clear this touches a lot of different work, different efforts, different agencies. This is actually our 9th year holding this open enrollment conference. We've been doing it since 2014. And this is also, if you're counting, this is the 10th year of open enrollment. So next year will be the 10th anniversary of actual marketplace coverage being available. It's going to be a big moment, and it's actually going to be a big moment for covering Wisconsin as well. That'll mark our 20th anniversary of being around. For those of you who are familiar with us from years past, we actually started off as covering kids and families. So I'm counting those years too. But 20 years. So we'll be celebrating that next year, but just be on the lookout. And, so much goes into making this conference happen. It's just an enormous effort. And I'm so thankful for so many. And I must thank those who are participating and helping out. So first, I want to thank our very supportive sponsors for this event, certainly Wisconsin Department of Health Services and Wisconsin Office of the Commissioner of Insurance, really critical in this effort. We also have Anthem Blue Cross Blue Shield of Wisconsin, Chorus Community Health Plans, Common Ground Healthcare, Healthcare Cooperative, Molina Healthcare, Group Health Cooperative of South Central Wisconsin, Molina Healthcare, United Healthcare Community Health Plan, United Way of Dane County, UW Health Unity Point Health Meritor Courts, Wisconsin SMP, Dean Health Plan, and Network Health. thank you again for your sponsorship. We really appreciate your support in this effort. This conference also has a steering committee, which outside of covering Wisconsin helps to think about just what are the really important topics that we need to address, who are speakers that we should include, and just really the logistics of the conference as well, making some key decisions about when, how, where. So in that steering committee, we have Maciel Gomez, Julia Garvey, John Rathman, Rebecca Repholz, Shelley Knorr, Jen Ball, Mike Moriarty, Justin Rivas, Helena Gilbertson, Caroline Gomez-Tom, and Allison, me. And then, of course, I have to thank my team. And actually, I'm going to take a moment here. I realized I meant to share my screen to reshare some of these wonderful people who are making it possible. So if you'll just allow me to do this for a moment. So again, these are our planning committee, some of whom are both part of Covering Wisconsin and on this planning committee. But we also have team members of Covering Wisconsin. We have, I think we're up to about 20 people at Covering Wisconsin at this point. And as I'll be sharing a little bit later in the conference series, we have new jobs that we're posting. So we have Kim, Shannon, Courtney, Colleen, Corey, Kirk, Cheryl, Caroline, and Stephanie. I'm gonna actually stop sharing because this is awkward for me, so I apologize. Katya, Nick, Kathy, Tony, Corey, Tina, Claudia, Quintella, Anthony, Adam, and Helena and Jen. So thank you again. This team is, they have their regular jobs, as I'm sure you know, if you've been involved in any kind of conference planning. They do this on top of the work that we're already doing at this time of year to get ready for open enrollment. And it's a lot, and they do it with grace and dedication and just total engagement. So thank you very much for that. I also want to mention we have many sub-award agencies around the state. So Covering Wisconsin has our in-house navigator team that I just mentioned, but we also work with many agencies around the state to provide this navigator resource and to be our partners in this effort. We have ABC for Rural Health, Central Hispano Dane County, Family Health Center of Marshfield, Gerald L. Ignace Indian Health Center, the Hmong and Hispanic Communication Network, which is a program of the Wisconsin Institute of Public Policy and Service, Northwest Wisconsin CEP, Partnership Community Health Center, Progressive Community Health Centers, and Workforce Connections. And let me tell you, this work goes beyond just these navigator agencies. We work with many other agencies around the state, either in partnership as we engage on networking and just coordination, but also mobilizers, sharing the word, spreading information. The list is just very long, but our thanks are just as long. A little bit later today, actually at the end of our second session, so we'll have 2 sessions today, as we will actually throughout the conference series. I will announce some gift card recipients. So we love doing this. We love thanking you for your participation. So today, later today, I'll be, after the second session, I'll be announcing the gift card recipients for those who submitted photos. And you, again, if you were watching the sliding presentation during our introduction, you saw many of the lovely faces of people who submitted photos, so thank you. Super excited to see those in this virtual world. And then we'll also be providing a gift card or announcing the gift card recipient for those who have participated today. So one of each of those, so we'll announce the names in a bit. There will also be 2 special opportunities after the conference ends, so post-conference opportunities that we invite you to join. We'll be providing more information about how to join these, but just as a heads up, both of these will occur on Wednesday, October 5th. So the conference goes through October 4th, and so this is the very next day. The first is, we've actually done these both in the past, so you might be familiar if you've attended before. One is for those of you who are in the pre-licensing and getting ready to do your licensing exam in the state. And we know it can be a lot of information, so we like to just bring in that community and give you a little bit more support and answer questions specific to that. So that'll be the first session we'll offer. And then the second one is a more general office hours. And that is for anybody who has questions after the conference, things they want to dive into a little bit more. And that'll be hosted. The licensing prep session will be hosted by Shannon Drakeber. And then the office hours, which is what we call the second session for anybody, that'll be hosted by Adam Van Spankeren and joined by Maciel Gomez from DHS. So like I said, we'll be sharing more information about how to join those as we get along in the conference series. And then just some, before we get started here, just some quick reminders. Please do keep your conference link open for today. Both sessions use the same link. Or if you happen to close it, just go back to the same link that you got this morning. That link is also posted on our conference webpage on our website. As you probably have noticed, all attendees are on mute and off video. You can post questions in the Q&A. Chat is disabled, but Q&A is really how we find it works the best for you to submit questions and for your presenters as they're able to provide answers. And then we are recording, so the recording of this session, as well as any content that's provided during the sessions, will be provided after the sessions are completed. So with that, I'm really pleased to introduce our first session today, and Jennifer Sullivan, who will be moderating for the opening plenary, which we have titled Shifting Set Pieces, the Current and Upcoming Stage for Wisconsin Health Coverage. So Jennifer Sullivan is Director of Health Coverage Access at the Center on Budget and Policy Priorities. She leads the Center's Beyond the Basics project, which provides training and resources about the Affordable Care Act's marketplace and other health coverage programs to support navigators and others who help people get and keep their health coverage. Previously, she has held roles at the Alliance for Health Policy, Enroll America, the Centers for Medicare and Medicaid Services, and Families USA. So with that, I'm going to hand it to you, Jennifer, and thank you so much.
Great. Thank you so much, Allison, and good morning, everybody. Thanks for inviting me to moderate this morning's opening plenary. It's great to be back in the enrollment space. I had a little hiatus from it for several years, but it's really good to be back. I also really love the title of this session. I think it's really fun. Shifting Set Pieces, the Current and Upcoming Stage for Wisconsin Health Coverage. I had the opportunity to see Hamilton over the weekend with my son, which was delightful and a reminder of everything that goes into a big Broadway production like that. And I think that the title really is perfect for what you all do as health coverage assisters. That's what you adjust to every year, is shifting set pieces. So even though the show might be the same, you help people get covered and stay covered. Unlike a big traveling Broadway production where you can reliably expect the set to be exactly the same from one performance to the next, in health coverage enrollment, the set pieces actually change from year to year. You've got the pandemic as an ever-evolving backdrop. You've got new props like standardized plans and new non-discrimination protections. And then you have that piece with the squeaky wheel, Medicaid unwinding, just waiting to be pushed onto the stage when you're least expecting it. Fortunately, we've got three of the very best experts in all of these changes here with us this morning to coach us through the fancy footwork we'll need to dance through all of these shifting set pieces with style and grace. We have Medicaid Director Lisa Olson, Deputy Director of Insurance Rachel Cissne Carabel, and External Affairs Liaison from CMS, Brenda Delgado. I'm going to introduce each speaker, and then she will provide brief opening remarks. And then after that, we'll move into a discussion. And there will be plenty of time at the end for your questions, so feel free to enter those into the Q&A box at any time. I'll start by introducing Lisa. Lisa Olson is the Medicaid Director at the Wisconsin Department of Health Services. Prior to this role, she served shortly as the Deputy Medicaid Director and as the DHS Assistant Deputy Secretary. She has also served as the department's Legislative Director. Prior to joining DHS, Lisa spent 9 years at the Wisconsin Primary Care Association, a role that I think many of you are probably familiar with her in. The Primary Care Association is the statewide association of community health centers serving, and she served most recently as the Policy and Program Director. Lisa has a Master of Social Work degree and a BA from the University of Wisconsin. Lisa, I'll turn it over to you first for some opening remarks.
Thanks, Jenny. Really appreciate it. And thank you for the introduction. And if I could just maybe start on a personal note, picking up where Allison left off, I want to say how excited I am to once again be part of the Covering Wisconsin Enrollment Conference. I've had the pleasure of working with Covering Wisconsin for about a decade. First, in my role as WIPCA, as you noted, we worked together to connect patients to BadgerCare coverage, and then in 2013, when we worked together with DHS, OCI, the Income Maintenance Consortia, other partners like Brenda at CMS, CBPP, Jenny, when you were with Enroll, to talk about and plan for how we could best support Wisconsinites when healthcare.gov ultimately went live. And I'm just so, I'm really impressed with how our collective partnership has strengthened so much over this past decade. It really does feel like we're a seamless team, sort of leveraging our collective strength to make sure that we're best supporting the people of Wisconsin. So again, thanks very much for having me today. The past few years have been really significant in the lives of the people we serve, as they have been for all of us, sort of the collective royal us. We've been in a national public health emergency, living through a global pandemic for over 2.5 years. And as part of that, we have maintained continuous coverage for now about 1.5 million Medicaid members. And that's significant. At the same time, we've been preparing for the end of that public health emergency. And again, building on the partnerships that we've intentionally built over the past many, many years, we've really been able to leverage those to ensure that we've planned effectively. We have had a plan in place for well over a year, and we continue to take every opportunity to refine that, to get additional buy-in, to incorporate new information, to ensure that we've got a really strong network of outreach partners to wrap support around our members, that we've got the partnership with navigators and certified application counselors who are best positioned to help members who might be transitioning to marketplace coverage in selecting the plan that best meets their needs. And I just can't thank the team of folks here today enough for all of that important work. I want to underscore that the good news is we've done something like this before together, certainly on a little bit of a smaller scale, but this team of assisters did support back in 2013, 2014, those who were previously eligible for Medicaid in connecting with coverage once the marketplace opened. So we've managed through these major coverage transition times by working together and again relying on our collective expertise and commitment to supporting every Wisconsinite in connecting with coverage. So those, I think that history and our relationships are really going to help us get through this next period of time and make it as seamless as it can be for the folks that we all serve. And finally, I'd be remiss as the Medicaid director if I did not mention, our ongoing support, the governor's ongoing support to become the 39th state to support Medicaid expansion, which would qualify, all adults in Wisconsin living up to 138% of the federal poverty level for Medicaid benefits, bring over $1.5 billion in savings into the state over the next biennium, and ultimately, support working people in Wisconsin by providing really essential support for healthcare needs of thousands of working Wisconsinites whose jobs either can't afford to offer health insurance at all, or they offer insurance that just isn't affordable to those lower income workers. We think now is the right time, and we'll continue to push for that. So I'll stop there, and we'll look forward to hearing from my other colleagues and enjoy the conversation.
Great, thanks, Lisa. Next, we'll hear from Rachel Cissne Carabell. She's Deputy Director of Insurance in the Office of the Commissioner of Insurance in Wisconsin. She's an experienced health insurance and employee benefit expert who has held leadership roles in both the public and private sectors during her career. Most recently, she served as the Senior Health Policy Advisor at the Department of Employee Trust Funds. Deputy Commissioner Cissne Carabell is a graduate of the University of Wisconsin-Madison. Turn it over to you.
Great. Thank you, Jennifer. So happy to be here. Thank you for inviting me to participate. This is actually new, unlike Lisa. This is a new conference for me, so I'm so glad to be part of this community. I also want to follow up on something Allison said about the growth in participation in this conference. That is great that this community continues to grow and support the network of individuals looking for insurance here in Wisconsin. It's such an important community. And I will say, one of the things, as an insurance regulator, we meet regularly with other states. We're a state-based system of insurance regulation. And so we often collaborate with other states to regulate the insurance industry. And one thing that we hear over and over again is how good of a job Wisconsin is doing in its partnerships to work together with our Medicaid agency, with Covering Wisconsin and the other stakeholders out there. And we really do appear to be kind of ahead of other states in working together to make sure that people are getting the information they need and that they're getting enrolled. So kudos to all of you for doing that. I think it's really important work, and others look to us as a role model in that regard. Thinking about this next open enrollment period, I would just want to mention, and some of you may not be aware of this, I think a lot of us who are watching what was going on at the federal level, many of us were really nervous about this open enrollment period. We weren't sure if the federal subsidies were going to be extended. We weren't sure about the time frame for the unwinding. Fortunately, a lot of things broke our way as we were planning for this session. So we're really excited about this open enrollment session. We have a lot of work to do for sure, but I think that things are going our way, and we look forward to working with all of you to make sure that we get people enrolled in coverage and that it's the coverage that they need. I would like to give just a couple of highlights, maybe before we get into the detail of some things that we're expecting to see based on the submissions that we've seen from the insurance plans that are going to be participating in the healthcare.gov marketplace. So just a couple of highlights about the market. The market does continue to be stable. It does change a little bit from year to year, but plans are offering competitive rates. We continue to see lots of insurers and lots of plan options available to folks through healthcare.gov. So we're very excited that we've been able to maintain that. That is a struggle in a lot of other states, and so our state is also doing very well in that regard. Like many other states, though, we are seeing rate increases this year. Thanks to the state's reinsurance program, we call it WISP affectionately, stands for Wisconsin Healthcare Stability Plan. That's a reinsurance plan that provides funding to insurance companies to keep premiums lower than they otherwise would have been. So we're expecting to see average increases in the single digits. So a lot of that is thanks to the WISP program. And of course, keeping premiums down increases access for individuals. We are continuing to see some service area shifts. A few carriers are expanding their service areas, a couple are reducing them, and we'll get into some of the details of why that might be. And that tends to happen from year to year. We're excited. One insurer is actually significantly expanding its service area. They're going from 9 counties to almost statewide coverage. And so they're going to have basically a statewide network. And then a few other carriers are changing their service areas, here or there with a few counties. We do have one insurer that is leaving healthcare.gov this year. It's one of our smaller carriers. So there are some changing dynamics. So it's going to be really important for all of you to make sure that you understand that information once we're able to share it in a couple of weeks, so that people understand how their choices might change. But we do know that there are going to still be lots of choices available on the marketplace. I mentioned the subsidies. So you may have heard the Inflation Reduction Act that was passed last month, I think. That did extend the subsidies that were available under the American Rescue Plan through 2025. So that's great news for us. We really were concerned that if those subsidies weren't extended, we were going to see even more higher increases in premiums. So the fact that that act was passed, it really avoided a lot of significant premium increases and potentially people dropping coverage as a result. So we were very happy to see that. Those subsidies extended. Another change that we're hoping to see as part of this enrollment period, some of you may have heard of the family glitch. It refers to a provision in the Affordable Care Act that has to do with determining whether employer-sponsored coverage is considered affordable, and whether or not, if it's not affordable, that individual then is eligible for subsidies. Today, that standard, that method for determining affordability only focuses on the single plan for an individual, but it doesn't look at the cost of a family plan. And so this has resulted in their estimates of up to 5 million people that are not eligible for subsidies because of this glitch, if you will, in the Affordable Care Act. The Biden administration earlier this year proposed a rule that would fix the family glitch. They have not finalized it yet, however, but we are hoping they've passed the federal comment period. So we're hoping that that rule is going to go in effect before the open enrollment period. And that will mean a lot of individuals will be eligible for a subsidy that are not eligible right now. And as a matter of fact, thank you. The Biden administration is estimating that the number of uninsured in this country could go down by as much as 200,000 individuals if that glitch is fixed. So we're very excited about the possibility for that. Fingers crossed that will go into effect. And then just one other change I wanted to highlight, because many of you, as I mentioned before, we're seeing a little bit of change in service areas. Some of that is being driven by a federal rule change that we know is going into effect for plan year 2023. And that is that the Biden administration has implemented network adequacy standards for plans. So there have been a lot of concerns about narrow networks, people not being able to access providers in their communities. And there hasn't really been enforcement or good definitions around what does network adequacy mean. The rule change did go into effect for plan year 2023. And so those network adequacy standards do apply. And a couple of our plans have had to adjust their service areas as a result because they weren't sure they were going to meet the network adequacy standards in every county. So it is having an effect, but that is one of the big new changes that we're seeing this year. So those are kind of the highlights. We can get into more of the details as we go through with the discussion, but just wanted to start off with some of those tidbits. So thank you again for having me. I'm very happy to be here and hear what the rest of the conversation, how it goes.
Great. Thanks so much, Rachel. And I think I share your and some of the audience's enthusiasm about the potential to fix the family glitch. So we are all waiting with bated breath.
Yeah.
Next, I'm going to introduce our third speaker, Brenda Delgado. Brenda is an external affairs liaison at the Centers for Medicare and Medicaid Services in Chicago, where she informs the public on CMS initiatives and Medicare program details. She began her federal service as a Presidential Management Fellow. Brenda is a graduate of Loyola University Chicago and received a master's degree in Health Policy Administration from the University of Illinois at Chicago School of Public Health. Brenda, good morning. Thanks for joining us.
Good morning, Jenny. Thank you. And thank you for this team. Thank you for the invitation. And most exciting, thank you to the 291 participants who are joining us today. Just going back, this is really a commemorative event. This is our 10th open enrollment period. And for some of us, this may be our first open enrollment period with Marketplace. For others, we've been here since the very beginning. What excites me, though, is thinking back to the very beginning when previous President Obama had given the challenge, the enrollment challenge nationwide for which state and which city could enroll the majority of the remaining unenrolled. We had some really tough competition in our region, Region 5, which covers the Midwest, but Milwaukee and Wisconsin really set the bar the very highest and won by the slimmest of margins, but well-deserved. And I just finished attending yesterday the Illinois version of this conference for all of their enrollment assisters and their navigators. And something that I really realized very quickly, and remembering back to that time when Wisconsin really set the bar at its very highest level, it's really an all hands on deck approach. It was across geographic areas, demographic areas, different age groups. None of them were ignored. It was such a comprehensive strategy that got us across that finish line of getting the highest and enrolled into the Marketplace. That really, with the resources that we have now, most excitingly, the largest funding given to navigators and the commitment from the federal government, that it makes me so proud to say that the official policy of the Biden administration, of the US Department of Health and Human Services, of CMS, is that every single American should have access to affordable health insurance. And to be able to say that just really gives me a lot of joy. I come from a public health background. This is my type of love language. And so this is really the opportunity that we really strive to partner with, but we do have some significant barriers ahead of us. We know that we are at the highest enrollment for Medicaid that we've had, obviously because of the pandemic, but that's going to give us a challenge as we get closer to the end of the pandemic. No, I do not know when the pandemic health emergency is going to be declared over. They don't give me that advance notice before it probably hits the front page of national news. But as soon as we do get word, we know we're going to still be committed to the 60-day advance notice for the states. And we are really already going full speed ahead with the resources of steps that people need to take now. First and foremost is updating their contact and address. They can do that now. We have a lot of outreach materials that we are hoping to place in a variety of different locations, whether it's drop-in articles, PSAs, social media content, a variety of flyers, other outreach materials to reinforce the message that people can take action now and share the information of updating their address, keeping their contact information up to date. And really, people sometimes need to hear that message. We know many times. Research tells us at least 7 times before someone actually takes action. So even if we are still months away from the end of the pandemic health emergency and Medicaid unwinding starting to take up more of our workload, that can certainly be something that we can achieve now and be creative in how we get that word across, whether it's at grocery stores or in a clinic or radio spots or newsletters. That is something that we are trying to be as proactive as possible. With that being said, we want to maintain, know that these communication lines stay open. The navigators have weekly calls with their project officer at CMS where issues are brought up directly to CISIO. I talk with the partners as well. My door is open, my email box is always open, And as we get closer to enrollment, if questions come up either on our website or any glitches that may have, or any policy verification that I need to get from our central office, please use me as your resource. This is really an opportunity for us to make sure that we don't have any stone unturned, and that we really work together, as I know that Wisconsin excels at, to make sure that every single person who is eligible for the marketplace can find the best plan for them and qualify for the subsidies that make it affordable for their own situation. Thanks, Jenny.
Great, thanks, Brenda. I think now, before we dive into our discussion, we're going to do one of our poll questions. So my technical assistants have put that up. Okay, great. I think one of you mentioned Brenda mentioned that some of you, this might be your first time doing assistance during an open enrollment period. So let us know, how long have you been in this field? We'll leave it open for a minute here. Okay, do we have critical mass on the poll? And are we showing the results? I actually don't know. We are showing the results. All right, good. As I would expect, a diverse group, a fair few folks, about a quarter of folks. This is your very first year. We're so glad to have you. You're in the right place. You're going to learn so much at this conference the next couple days. And then there's folks, I think the biggest group were people who have been in it to win it for 6+ years, maybe since the very beginning. So, as I know, most of our panelists have been. So with that, we're going to dive in. We have about 40 minutes or so. We'll have a discussion, and I've tried to frame that in terms of four sort of questions to tip us off. And the first one is, I think at inflection points, it's always helpful to look back. What have we learned going into this? What lessons from the previous open enrollment period, or even before that, do we want to bring along with us as we get ready for this next open enrollment period? And Lisa, maybe I'll start with you for this one.
Yeah, thanks, Jenny. Right, of course, within the Division of Medicaid Services, Medicaid enrollment is year-round, so there's no such thing as open enrollment when it comes to BadgerCare coverage and Medicaid coverage. But I think one of the things that we continue to learn every single open enrollment period, and in general in partnership, that we've built over the years and really formalized through what we maybe uninspiredly call our DHS OCI partnership, is really about really refining our outreach strategies. How are we refining our data tracking abilities, and how are we continuing to build upon the lessons we've learned in prior years to make sure that we are truly connecting with people in a way that is best for them, in a way that, as many of you have indicated on the poll and in the registration forms today, a number of you have been doing this work since the first open enrollment period, and so you've got established relationships with the patients, the clients, whatever word fits best for the relationship that you have with the folks that you support through the enrollment process. That matters so much when it comes to having a trusted advisor who can support you through the process. And so every year when we come together and we do a debrief of what worked, what didn't work, what we want to do differently and better next year, I think that's just always been an important opportunity for us, and has helped us to really think about what's going to work when we move to the public health emergency unwinding as well. And I know we'll have some time to get into that, but partnership, I feel like a broken record, but that's what I always continue to learn.
Great. And Rachel, how about you? And I know that this is not a role that you've been in for many, many open enrollment periods, but I know you have some good wisdom to share nonetheless.
Sure. And I have a fabulous team here at OCI. And they certainly have been around and through many open enrollment periods, and they have schooled me on kind of how this has all evolved. So I definitely, OCI has valued, like Lisa said, that partnership for sure with DHS, with the health plans, with the different assisters. That partnership is really critical, to making things work for consumers. So I definitely agree with Lisa on that. The other thing that I would add is that what we've really learned, and I guess we probably already knew this or could have assumed this, but what we saw after the last enrollment period was a confirmation about how much the affordability of the premium really matters. And the jump in enrollment that we saw in the individual market as a result of the availability of the subsidies to bring down those premiums is really evidence of that. So that we just really got that confirmation that has to be a focus. Cost has to be a focus for sure if we really want to continue to make progress in getting people enrolled in care. I would also point out that since open enrollment last year, we have received a federal grant to do a market scan of the individual market. And that has also really taught us a lot. And we're just now starting to get that information out there. We've shared it with our partners through our kind of formal partnership that we have. And it's provided a lot of great data on not only who's enrolling in the individual market, what kinds of plans are they buying, but also who are the uninsured and why aren't they getting enrolled. And so there's a lot of great data out there, and I'm going to make a bit of a plug. If you're interested and want to see all of that data, you can visit our website. It's oci.wi.gov/market-scan, and there's a ton of great data in there about the market. And we've learned, lots of things, and we're going to be able to use that information going forward to target our outreach to make sure that we can get more of the uninsured into coverage. So I've got a lot of data, if folks want to get into some of that, but what that data shows is that there's still a lot of people that really don't know about healthcare.gov. So outreach is going to continue to be key to getting people enrolled. There are different pockets of the state where there's, we've done, or the community has done a better job, but there are still definitely populations and communities across the state who still just don't know about what their options are and the availability of resources.
Thank you, Rachel. And I'm sure we'll be able to get the links to that page you referenced to folks in the audience too, because I'm sure that sounds like there's a wealth of data there that folks would love to dig into. Yep. Brenda, how about you? What are your main takeaways from the last open enrollment period, or even previous ones, that you want to make sure people bring along with them this time?
Sure. I love the availability of as much data as possible, but it also helps to just have some anecdotes from people who are out in the field and get some feedback of what they are seeing when they are either walking the streets or just talking to people. Because putting those two things together really just gives us such a global picture of how outreach is needed, where it's needed, in what manner do we deliver it. And absolutely, like Rachel said, there are people still who do not know that healthcare.gov is an option. There are people that do not know that Medicaid is an option, even at these high enrollment numbers that we have. And so being able to understand the data is really key, but also falling back on the trusted partners who understand the really small pockets of communities is even more valuable sometimes. Some of the examples that I just heard yesterday at Illinois conference, I'm not new to this game, but still it surprises me to see some of the struggles that we have in reaching people. We have navigators who go serve a community where they know that they have a large number of uninsured, and they're walking the streets and they're talking to people and they're inviting people to make an appointment. But just the observation that people do not respond to flyers sometimes, they do not respond to them having to make an appointment. But if navigators come with a laptop to a health event or to a school event or to a community event or to a kids fair with a laptop that they can make the appointment right then and there for the person then commits themselves to making that appointment and will show up, sometimes not to a navigator location. Some navigator locations are not trusted locations. They may be tied or recognized as a government location, or maybe a low income location. They don't feel comfortable, but a neutral location like a library or a school, sometimes even restaurants, really turns the really hard to reach into a welcoming situation. And we've heard this before, we've heard this years ago, but just to still hear it, that it still exists today, it's just good to refresh the memory. And then also understanding when people enroll and what plans they enroll in. Like Rachel was saying, the data is most helpful. The people who are going to traditionally enroll at the very beginning of an enrollment period are people who are eager to get healthcare coverage, know that they have to find a plan, maybe have high health concerns and are waiting for that enrollment to open. And on the other side, people who are going to wait till the last minute, till that deadline, till that 7th time that they hear the message, are the ones who are most disengaged. They are waiting for, to get around to it. They may not be familiar with what even healthcare coverage is, and they just need to get it done. And it trends higher to see where our resources are with our call center versus our website. The call center gets a lot more discussions of people who want to have a conversation with a navigator or go over their options. And people who go on the website healthcare.gov on their phone are people who spend much less time at the end of enrollment period, right before the deadline, just get on there and just choose a plan. So in planning your outreach strategies, knowing that there's a variance in need of time, and when working with partners who serve those two distinct populations, and really trying to understand where are your resources used best as we start from the beginning of enrollment till the end of enrollment, and really going up on deadlines. We always see that last minute rush. So anticipating that rush and trying to preload as much of that workload before that very last rush is also very helpful. And lastly, just staying in touch with each other. You do not need to know every answer to every policy question or to every issue, but somewhere in your circle it is. And so please don't be quiet with, oh, I don't understand why this website, why the subsidy is not coming at the same amount, or this plan just doesn't look like the best option for me. Is there really something else that I'm not really seeing for enrollment options, or any other concern or question? Please don't stay quiet on that. Reach out to this network, reach out to maybe a more experienced navigator, or even anyone that's specifically with covering Wisconsin, who's been doing it a long time. Because we certainly are there to help each other, and we sometimes have new questions that we don't understand, and we have to get our brains together to get the solution. But again, that's what everyone's goal is here. So let's not be shy about partnering up and getting whatever answer needs to get people covered.
Terrific. Thanks, Brenda. And I couldn't agree more about the end of season rush. And luckily this year, like last year, that rush will not be happening during the holiday rush. It will be in January. So hopefully that literally gives folks more weeks, but also maybe a little bit more breathing room by having that open enrollment date in January 15th. So the next question in my 4-question series here, we're going to cast our gaze more to the present moment. I'm going to ask each of you, what's going to be different this year? What do assisters need to know? Maybe it's about the application, maybe it's about the plans that will be available, maybe it's about how to prepare and answer questions about unwinding. But I'm going to start with you, Rachel. Tell us what will be different this year that assisters need to be prepared for.
Yeah, and actually, before I answer your question, Denny, I want to go back and reinforce something that Brenda said. Again, I mentioned that study that we did that included a survey of a lot of individuals, And one of the things that we found is where awareness about healthcare.gov was the strongest, it was in the, it was those informal relationships people had, learning from their neighbor, trusted local resources. Those were the places where that communication was happening, and that really does play a significant role in making sure that people are aware. And again, I think people in the outreach community have probably known that for a while, that often works, but it was reinforced in the research that that we did talking to people, that is a very important part of getting the word out. So I just wanted to reinforce that. As far as things that are going to be different, as I suggested before, there are going to be premium rate increases this year in the market. Overall choice is increasing, so choices of plans and insurers, that's going to be increasing, so that's great. But for a variety of reasons, we are going to be seeing rate increases, and that's not unique to Wisconsin. Some of that is kind of the response to COVID and things like that, challenges in the cost of healthcare and whatnot, that just seems to be hitting this year, maybe more so than it has the last couple of years. Something else that we've learned that's really important and to think about is how many people in healthcare.gov actively re-enroll in their plan. So we found that 75% of people who had been enrolled and were re-enrolling last year actually actively re-enrolled. So they went in and they looked and they chose their plan. So that is a very high level of engagement, and we think that that's really positive. And so that's something to keep in mind, that there's a lot of that going on. The thing that we want to emphasize, and this is something that's always been important and isn't really new so much, but and it's a key for the assisters, is to make sure that when people are re-enrolling or are new to healthcare.gov, that they're looking not just at the premium, right? They're also checking to make sure that their provider remains in network. Provider insurer relationships change every year, and so it's really important that people confirm that when they go back in and shop. And then the other thing is to make sure that people are aware of what the cost sharing details are, right? Those are the costs that people incur when they actually go to use services, so after they've enrolled, and making sure that people understand that some of these plans have really high cost sharing, and there may be other plans that are still affordable from a premium standpoint, but maybe have lower cost sharing. And that's really important, because when people are surprised because they're incurring more cost sharing, that could, change their behavior in terms of how they seek care. And so we want to make sure that people have a good understanding of what that cost sharing is. And then also that there are certain plans, the silver plans in particular, where there are subsidies available for that cost sharing. So making sure that people understand that dynamic it's complicated, it's difficult. And so as assisters, you can all be really helpful in making sure people understand that. So that's not necessarily a new change, but it is something that, we just want to keep emphasizing that the assisters can certainly help with. We have seen also a lot of folks select those bronze plans. So those are the ones with the highest cost sharing, but the subsidies for cost sharing are not available. So that's just something to keep in mind. And then the last thing I would want to emphasize is making sure that as part of that active re-enrollment, people are going in and updating their income. We don't want to see people hit with penalties later in the year because their income changed and it turned out that maybe they weren't eligible for the subsidies that they received. So we want to make sure that folks are updating their income when they go in and actively enroll. So those are a couple of things that I would want to highlight. And then of course, and I think it was maybe Brenda that mentioned it, but the other thing that's different, right, is all of the new federal money that is going into the Navigator pool. That's really, really important to expand the resources that are available to help support this community. So that's great. We're very thankful that the federal administration was able to provide that additional funds. And thank you to Covering Wisconsin to to basically use that money and get more resources out there for folks. So that will be a big change that we hope will help with this awareness issue that we talked about.
Thanks so much, Rachel.
Yep.
And I'll just make a little plug here that Health Reform Beyond the Basics, we're in the middle of our annual training series that I know many of you join, and tomorrow happens to be our annual webinar on plan selection strategies. It's recorded. You should by no means miss any of this wonderful conference to attend it, but you can find the recording of that and related resources on our website, and hopefully those can also provide some useful supports while you're helping folks navigate what sounds like it's going to be another year with a lot of choices. Lisa, what's going to be different from the Medicaid angle?
Yeah, thanks, Jenny. I think one of the things that's going to be different from the Medicaid angle is that we have invested in a lot of new technology to make our communication and our platforms that our members engage in so much easier to navigate. So for the first time, right, DHS is going to be texting and directly emailing members with information about their renewal date once the public health emergency ultimately ends. We want to make sure, right, in addition to physical mailing, which we know connects with some members and not with others, that we're taking advantage of all of the opportunities that we have to be able to communicate directly with folks. So, right, just another way to ensure that people get notified of the important information they need and the actions that they need to take. And so we'll continue to encourage, right, that folks who have cell phone numbers, email addresses, add that contact information with us. We also have a ton of new features on our mobile app that make it much more user-friendly. We've updated parts of, right, the access.wisconsin.gov website to really just modernize it towards the tail end of last year. We made some pretty significant updates to our Am I Eligible module to make it easier for people to check whether or not they're eligible to get support for various state programs by, entering some basic information. We reworked many of the application screens just to focus on better layout, clearer language, a faster application experience. And last year, for the first time, we added the functionality for our members to select an HMO online. Up until the end of last year, this was strictly a paper form. So glad to be able to have moved into the 21st century on that. So again, all of these new features we think will have made and will continue to make a better, more user-friendly experience for our members, and is also a support to, right, all of our assisters as well. Right, it is that much simpler for you to sit down and help walk someone through the application process. We also have, right, a ton of new outreach materials, right, a series of videos focused on our stakeholder community to help our members navigate the process. We've got a new online help center. So all of that is great. I think as it relates to the public health emergency, right, in my opinion, the most important thing that we can be communicating to members is that their coverage is continuing, right? The public health emergency has not ended. Our federal partners at CMS have, right, continued to reiterate that they'll provide states with 60 days notice before that public health emergency ends. And that is not a thing that we have received. So we're confident it won't end in October. We'll learn mid-October about, right, the next extension of the emergency, which in every other instance has been a 90-day public health emergency. So, right, if all of our crystal balls are working properly, and maybe if we're nice enough to Brenda, she'll secretly tell us. I'm just kidding, Brenda. Right, we would anticipate, I think, that the earliest end of the public health emergency might coincide with the end of the open enrollment period. So, so for the purposes of open enrollment, right, Medicaid coverage is continuing. I think the next important message is that, right, members can and should update their contact information with us through access.wisconsin.gov or the My Access app. And importantly, we will contact them when it is time for them to take action. We have a plan for how we're going to move through the unwinding period over the course of 12 months, and we will be in touch with every single member when it's time for them to take action. And in the meantime, our coverage is continuing, and it will be infinitely helpful if they update their contact information every time it changes, right? A new address, a new phone number, a new email address.
I have a quick follow-up question for you, Lisa. If sisters are helping somebody with a marketplace application, but they're in a family where you've got some folks in Medicaid, some folks in marketplace, are there steps that sisters can take now to make sure, like, to help people get their address updated on the Medicaid side?
Yeah, absolutely. So again, that those two platforms, so if they have the mobile app downloaded, that's a great way to get their contact information updated with us. If not, again, the access.wisconsin.gov is how you would support someone to log in and update their contact information. So every time you've got someone sitting in front of you or virtually on the screen or on the phone, if there are sort of dual enrollments in both the marketplace and in a BadgerCare plan, asking for folks to update their information across the board is always helpful. We of course share information back and forth with the federal marketplace, but it's helpful to do it in all appropriate places.
Great. Brenda, what feels different or new looking at this open enrollment period from your perch at CMS?
Really what we are encouraged is that we have the highest number of enrolled people now, whether it's in the marketplace or in Medicaid. And so we are getting closer to our goal that everyone has access to affordable health insurance. And we need to just maintain people in a plan or in Medicaid whenever appropriate, and making sure that they know what is their best option going forward. It's great to hear that 75% of people are choosing to actively re-enroll. That is a really high number. That's a really great number. And just like Rachel was saying, some people are choosing the bronze plans. So that's also sometimes in most favorable circumstance for someone who is seeing past that high deductible plan. There's many options in understanding how you can receive your health care, and it is not always the best to use your health plan that would cost you more through a hospital, for example. Even in my own personal situation, if I'm in January and I have not met my deductible yet, and a kiddo gets sick, I know that my health insurance will let me go to urgent care for a $5 copay, or I could take them to their regular pediatrician for a sore throat, and I have to pay that $150 deductible because I haven't met my deductible yet, probably in January. And if it's a sore throat, or I just need a prescription or an inhaler medication updated, I run to urgent care, and I get seen immediately. And my insurance lets me go there for $5, even if people have other insurances. Usually urgent care, CVS, clinics, those types of things are less expensive. So this is really an issue of understanding healthcare, and that is not easy to do. I have a master's degree in this, and I've been in this game for decades, and I still sometimes make the wrong healthcare choices for myself. In hindsight, I probably could have chosen a little bit better. So again, learning how to understand these health plans. I think tomorrow's webinar, after it's recorded, I'm going to be sitting on it myself, Jenny, to see how to make the best plan choices. That is highly valuable, especially seeing that recording again after the plans come out in October. I would probably suggest going back, if it's recorded, and seeing that same webinar that you're going to host tomorrow, and seeing it with the light of, okay, now that I see what plans are out there, let me refresh this plan choices. Lastly, I would also just say that people need to understand how affordable these plans will hopefully be. Rachel knows more about the plans than I do, because I don't get to see the plan rates until they're publicly released. I don't get that preview, but we do know that people were unaware and surprised at how affordable it was with the expanded tax credits, and it made a huge difference in them choosing to enroll once they understood how affordable it was. They are constantly surprised how many options they have, how high the tax credits can be in certain scenarios, and really seeing if the silver plan with the premium subsidies is the best choice for them. So it's, again, educating the consumer on what options they have. And we saw it across the country, regardless if there was a state that had higher premiums in another state. The expanded tax credits made a huge difference. And since they are continuing going forward, we really want to encourage people to see what their own situation is, and then pick a plan that best fits their own scenario. But they have to at least engage after that first step. Let's just see what options are available and then make that choice. And that's the biggest barrier. And once you get over that barrier, it really does kind of smooth roll down the hill after that of, oh, I have 7 plans under $20 premium. This is really great. And they can see what affordable health insurance can look like.
Okay, we have about just shy of 10 minutes before we're going to move to questions from the audience. So we'll call it our lightning round. And I'm actually going to truncate. I'm only going to ask 3 questions today. But the last one is, what one issue or 1 or 2 issues keep you up at night, enrollment issues? And what is your agency doing to address those? And anybody can jump in here.
So I can start. So quickly, my 1 or 2 issues, it's awareness, right? We've talked about that a lot. Educating, outreach, getting people involved, and cost. Premiums, we know, drives participation. What are we doing about these? So the good news is, as someone else already mentioned, we're in our 10th annual open enrollment period. Our numbers are up and we feel really good about that. But we also know that a lot of that is being driven by the premium subsidies. So we're working with the stakeholders. We've already talked about that. We've got a lot of collaboration going on about outreach efforts. We're using that federal grant that we use to target additional outreach into communities, in particular rural areas, which is where we found some of the awareness is at its lowest, and to target certain populations that we know seem to not be enrolled or not hearing the messages. We also are, we've found that in our urban areas, we've got a lot of, that's where our uninsured are at the highest. We're seeing most people in our urban areas, even though there is a lot of awareness. So making sure that people, even though they're aware, they're also engaging and getting in and enrolling. With regard to cost, I briefly mentioned our WISP program, the Healthcare Stability Plan. That is critical to keeping costs in the individual market down. Making sure, and then looking for opportunities to improve that program and possibly expand what's available there so that we can continue to drive, drive premiums down lower than they otherwise would be. So that's a critical component in keeping those costs down and therefore keeping people enrolled in their plans. So those are some of the things we're working on.
And quick follow-up for you, Rachel. Can you speak a little bit about how the premium tax credit helps insulate people from some of these premium increases? Because I'm not sure that everybody in the audience, knowing that some folks are new, they may not understand that.
Yeah, and it's you do kind of have, as Brenda said, insurance is tough. And this is a part of insurance that is especially tough. But the reinsurance program, it's essentially we cost share with health plans in terms of who their highest cost employees are. So we set eligibility standards and say, for individuals that incur this much in claims, we will help offset your costs. So that reduces the risk that insurance companies would incur when they expand to this population, and it allows them to set their premiums lower. So when plans submit their rates, they tell us, well, this is what the rate would be without the WISP program, and here's what it is with that program. And the difference is actually startling. So what we're seeing is that rates could be 20% or more if we did not of an increase if we didn't have WISP. But with WISP, as I said, we're going to see average rate increases in the single digits. So that is significant. If anything happened to that program, if we didn't have that program, the effects could be significant because the rates would be that much higher, that much more unaffordable. And so we'd likely see much less enrollment in the individual market. Does that help, Jenny? Is that what you were hoping for?
Definitely. And I think the other thing that folks should keep in mind is that the way that the premium tax credit is calculated, it is based on a percentage of a person's income. So we're not looking necessarily at, and we're looking at the difference between that percentage and the second lowest cost silver plan in the market. So if rates have gone up, the corresponding tax credit may be more generous as well, which gives the consumer that much more purchasing power when they're comparing their options. But lots of resources to help folks get up to speed on all of the premium tax credit calculations if that's an area where you feel like you want to brush up.
Yeah, and I would be remiss, I'm sorry, Jen, I would be remiss, I know we're running out of time, the way that reinsurance program is funded, so there are state funds in it, but it's also primarily funded with federal revenue. We have a waiver under federal law, and so by keeping those premiums lower, that means the federal government pays out less in tax credits. And so the federal government, CMS, lets us take those savings and divert it into the reinsurance program. So that's how it's funded. We're saving on the tax credits because overall premiums are lower. So again, that's a little bit of insurance 101 there.
Yeah, that's great. Thanks audience for letting us wonk out a little bit. That's what we like to do best. Lisa and Brenda, you both have a chance to get in your last word. What's keeping you up at night, and what's your agency doing to address it?
I would say prioritize the people who are likely to enroll as soon as possible. Also knowing that we are going to keep ourselves accountable to the 60-day notice for the pandemic health emergency. So that means it will not end in October and November. We are already past those dates. And also knowing that there's the special enrollment periods that people can continue to enroll after enrollment ends. So that includes if you lose coverage, or for example, if you're under 150% FPL, you can continue to enroll. So think of people who just above that are really the target group that we need to find as soon as possible. Think of gig workers who have income they think may be higher than they really are, but after they do all their business deductions and they're self-employed, what they are reporting on their taxes may qualify for higher APTC, the tax credits, so they can really find affordable coverage, and just get people to see those tax credits, what options they have. If we hear it over and over again, if they can just have that one step of seeing what tax credits and how low it can be. It could be a $10 plan, it could be a $20 plan. Then all of a sudden their options of, oh, this is something I really can afford, is realistic and something they can actually understand.
Yeah, super important advice, Brenda. I completely agree. And to your point about the 60-day notice, I think the thing to maybe think about is that there's a chance we do get a 60-day notice during the open enrollment period, right? And so I know this group is really good about clear communication, but I also recognize, right, every time we approach a potential deadline related to the public health emergency, there is coverage about it. And so that does create some confusion for folks who are moving between plans, who are currently enrolled in a Medicaid program. So again, you all every day take the most complicated set of information and boil it down to its component parts to support people through the enrollment process. And so, right, using those same skill sets to support people in understanding, right, all we need you to do is update your contact information, and then we will be in communication with you when it's time to take action related to your Medicaid coverage. It's just that clear, consistent communication that we need. I also just want to make sure folks are aware we've got a number of additional resources available to all of our assister partners. So if you haven't already, please do look to our Unwinding Partner Toolkit on the DHS website. You'll find, again, a range of different materials to support and share all of the messages I've been talking about. We just reworked the page. We're adding new materials all the time, and think that will be a great resource for you all, in addition to the session later this morning with a number of our eligibility and enrollment experts at DHS.
Terrific. Thank you all for the wonderful discussion. And we're going to pivot to questions from the audience. But before we do that, we have our second poll question for this session. So I think Michael's going to go ahead and post that. There it is. I think most folks can probably see, but just in case we have any folks joining by audio, that question is, which of these do you think has the most success encouraging consumers to get enrollment help? You can choose one of the following: advertising, outreach within specific communities, individual word of mouth or referrals, or I have no idea. I'm new here. I think we heard some verbal ideas to the answer to this question from our panelists earlier, so I'll be curious to see what the audience thinks. Are we about ready to close the poll? Let's see. All right. Very close between outreach within specific communities and individual word of mouth or referrals, which is great because advertising is really expensive and it plays a role, but it's not always the most bang for your buck when you are doing in-person assistance. So very good. All right, at this point, welcome folks to continue entering your questions in the Q&A. We do have up to about 20 minutes to take your questions, but I'm going to go ahead and start with a follow-up question about the family glitch. Does anybody have any more information to share about it? And maybe somebody could just share again, just the top lines. What is the issue and what is the proposed fix in the rule that we're expecting will be finalized soon?
So the family glitch rule is proposed. I can actually double check to see if we have any guidance on when the final rule will be issued out, but it just determines how much APTC you are eligible for if you had family coverage that you're shopping for the marketplace, because currently if you have employer coverage that is based just on your coverage as a single employee, it doesn't incorporate how much your employer coverage is costing for family coverage, and to say that family coverage is unaffordable to you even though individual worker coverage is affordable to you. And this is very common across many industries. The employer decides to have employer coverage very reasonable, and that makes that person ineligible for premium tax credits because the requirement is that your employer coverage needs to be unaffordable in order to qualify for tax credits. But the employer needs to cover their family. And when the employer looks at the options for their employer coverage for family coverage, it could be 3-4 times as much more for family coverage than what that employee has to pay for just themselves from their employer coverage. And currently the previous rule did not take that into consideration. How unaffordable is family coverage, which is what people actually need to buy, to say employer coverage is not affordable to you. Because it's unaffordable, you can go buy get the tax credits from the marketplace. The family glitch proposed rule was proposing to reverse that and say we will now consider the affordability of family coverage, and if family coverage is unaffordable from your employer, then we will allow you to come into the marketplace and get tax credits for your plan. So I can check maybe before this conference is over to see if we have an expected date of when that final rule will be issued out. I don't know if Rachel, if you had anything else to add.
No, I think you did a great job, Brenda. I will tell you, every time I try and explain it or someone explains it to me, I get caught up in all the double negatives. So you did an amazing job in explaining that. It is a complex issue. And yeah, anything you can share about the timeline for that would be appreciated for myself, as well as I'm sure many of the audience members.
Okay, another question for you. Let me see if I can find it here, Rachel. I think this is going to be for you, which is about availability of plans. This person has said that in northern Wisconsin, we've only ever had 2 plans in the marketplace and only 1 participates with the primary medical facilities in the area. Will this ever change?
So I can say across the state, there's one carrier in particular that is expanding to almost the entire state. And as a result of that, many of the other changes are kind of 1 county here or there, 2 counties maybe. But because of the expansion of one of these carriers, actually in most counties, we are likely to see at least 3 plans, three carriers available. So again, expansion of choice in those counties is going to be a very, very good thing in those markets. So, and actually it's interesting and I don't think that study that I shared shows this, but I've seen these maps that show kind of year by year how many carriers are in a county. And, it's great to see how, we went from a lot of yellow to, actually, I think it's yellow to orange to red, but you can just see year by year growth in the number of plans that are available in counties across Wisconsin. So I think in every county, we're going to have at least 2, but in most, including up north, we will see at least 3. And in some counties, I think we have 6, 7, and maybe even 8. So we have a significant amount of choice in Wisconsin's healthcare market.
That's great. And if folks decide to join for my policy session tomorrow, we'll talk a little bit more about standardized plans, which are a resurgence. They're having a resurgence right now. They were sort of early introduced several years ago, went away for a while. They're back this year. And the ways that the rule is constructed will just result in more plans, which could be a blessing or a curse depending on where you are, but there will be that will be sort of a new player on the scene this year. Question, and I can answer it, but I'm going to let our panelists have the first take at it. Just to clarify, back to affordability and affordability of employer-sponsored coverage specifically. What is the threshold? Just some folks wanted clarification on what the percentage is that makes an affordable, an employer offer affordable for an individual. And I can also answer it if folks don't have it.
I'm going to look, I'd have to look that up to make sure I'm not off by half a percentage. Is it 9%? I'm not, I don't want to say
it's
for sure.
9.12 this year.
9.12. See, I'd be off by 0.12%, and then you'd say the federal government doesn't even know what percentage it is. Yeah, I'll let that out. Thanks, Jenny.
Yeah, no, of course. And that's just the percentage that the individual employees offer of self-only coverage. If it's more than 9.12%, then it's not affordable. They could get tax credits, as could their family members. But if their offer just for their own coverage is below 9.12% of their household income, then they can't get PTCs, and neither can their family members, and as long as their family members are filing taxes together with that employee. Let's see here.
And one thing I would add to that.
Go ahead, Rachel. Yep.
Oh, I'm sorry, Jenny. Oh, sorry, you cut out there for me on a second, but I was just going to add, and this may be meaningful to some of you, that test of the percentage of income, my understanding is it's looking at household income. So everybody in that family, not just, that's that individual.
That's absolutely right. That's absolutely right. Another question, and I think Lisa might be a good person to answer this. I think you have put a fire in the belly of folks, and they want to make sure that people are not accidentally in the marketplace if they should be in Medicaid or vice versa. But there's sort of some, I think if you could provide some clarification about what happens to somebody if they go to healthcare.gov or they go to an assister to get coverage, and it turns out that their income makes them eligible for Medicaid. Does the assister have to do something different for that person, or how does that get handled?
Yeah, we do have file transferabilities between the state and healthcare.gov. So if someone if a family applies for coverage on healthcare.gov and one or more members of that family is eligible for BadgerCare, that file does come right directly over to the state. So rest assured that that information will get to us, and we'll be able to enroll folks into BadgerCare Plus coverage or whatever coverage they might be eligible for. I think it is always helpful as you're sitting down with folks, if you do know that you've got members of the family that are enrolled in a Medicaid plan, that they're updating their contact information with us through the My Access app or through the access.wisconsin.gov website, so that we can be in touch with them. And again, that coverage will continue until we hit their redetermination date, which could be anywhere between the end of the public health emergency and 12 months later, just depending on when they first enrolled with us. It's sort of a first in, first out approach we're taking for the redetermination process.
Great. Brenda, I have a question for you, and your colleagues can help you out if you want it or need it. But can you talk about tax credit eligibility for people who are turning 65 but aren't eligible for Medicare because they don't have sufficient work quarters in the US?
So if you are not enrolled in Medicare Part A, you can if you're not enrolled in Medicare, you can continue in Marketplace. This is really maybe more of a situation for because you're eligible for Medicare also depending on a spouse's eligibility. So be very careful on making sure that you are not eligible for Medicare under your own working hours or your spouse's working hours. But if you truly are not enrolled in Medicare, you can continue to be enrolled in Marketplace with premium tax credits. What we definitely do not want people to do is think that they can be enrolled in Marketplace and they are eligible for Medicare, because then if they are enrolled in Medicare, they are not eligible for the tax credits, and that would be needing to be paid back, or there is no coordination between Marketplace and Medicare. So it is not just do not do that. Do not enroll in Marketplace and Medicare at the same time under no circumstances. You don't get the tax credits. They don't work as secondary coverage with each other. That is just never a good situation. But we understand certainly some people don't have eligibility for Medicare, and they would be, depending on their income, eligible for tax credits to enroll in the Marketplace. But really dealing with a navigator, I think helps in that situation. We certainly have had sometimes issues with some brokers who don't understand that and give bad advice, but I think that we train our navigators very well to be very clear. People who are on Medicare do not need to be looking at the Marketplace for an option. People who are on Medicare can either choose to go to Medicare Advantage, which are Medicare health plans like HMOs or PPOs, or they can choose to buy a Medigap supplemental policy if they want to get additional coverage for their copays and deductibles, and buying that extra insurance. Or they could possibly be enrolled in both Medicare and Medicaid. If their income is low enough, they would be dually enrolled, and then most, if not all of their healthcare coverage would be covered if they're enrolled in both Medicare and Medicaid. But Medicare and Marketplace do not mix. I don't know if Lisa or Rachel wanted to, or if you, Jenny, wanted to add anything else.
Okay, I don't. Oh, Rachel, go ahead.
I was just going to say, I don't have anything to add.
Yeah, that was great, Brenda. I'm glad we have a resident, someone who speaks Medicare in the group, because that's definitely not me. Okay, a couple questions, Lisa, that sort of speak to postal delays, workforce capacity, paper shortages, all kinds of reasons why paper is a really hard medium to rely on right now. And we know that communication is going to be so critical to helping people successfully navigate unwinding. Can you give folks any reassurances as they live amid all of these other barriers?
Yeah, I appreciate that. I never thought I would be talking about paper shortages so much in my entire career, and yet here we are. So yes, right. Paper mail is one of the ways that we communicate with our members. as I mentioned, we've been able to and have now tested successfully our texting capabilities with members. So we have not yet sent out significant messages, but intend to once the public health emergency ends. And we know that the vast majority of our members do have cell phones and can receive text messages. So the ability for us to communicate in that way is going to be incredibly helpful. We can also, again, for the first time this year, start to email members updates about their benefits, about their redetermination dates. And so we intend to use all of those platforms. But we also have, again, really strong relationships with our HMOs, with Covering Wisconsin, and with our provider community. And so when it comes to ensuring that someone is aware of their redetermination date, we're going to lean on our HMOs to help reach out to those members and make sure that they go through the process. We will also make sure that if you've seen your provider in the past year, we will make sure that your provider knows that the timeline of your eligibility redetermination date coming due, so that they can also support you in moving through that process. If we have someone who is no longer eligible for Medicaid once the temporary rules under the public health emergency end, we're going to be providing those lists to our partners at Covering Wisconsin so that they can support some additional connection to the marketplace if that's the best option for that individual. So we've got a number of different angles of communication that we are moving in addition to paper, recognizing the reality of the paper shortages. In terms of the workforce shortages, something we're also very much keeping our eye on. We have these incredible income maintenance consortia across the state who do an enormous amount of work every day and are really gearing up for the redetermination period that will begin again once the public health emergency ends. One of the things we've done at the state level to really wrap some support around those consortia is to create there's sort of a surge pool of staff at the state level. So if we're going to be monitoring really closely to make sure that everyone, each of the consortia are moving through their redeterminations at a good pace. And if there is a spike in cases, or if someone becomes ill at an IM consortia and just needs some additional support, they'll be able to tap into this surge pool of state staff to support it. It's actually something we did during the public health emergency with our contact tracing system, We had surge contact tracers at the staff level. So if any county public health department needed some additional help in contact tracing, they could tap into it. So replicated that model going into the end of the public health emergency so that we can do as much as we can, in addition to some of the financial resources we've been able to provide to think through what might the barriers be and how can we put a number of mitigating strategies into place so that this is as successful as possible.
Very good. I know it's definitely an all hands on deck phenomenon, and it has been this whole year. So I think that's good. It's bought us a lot of time for everybody who needs to be ready to be prepared for anything. There are a lot of questions coming in. I want to acknowledge there's a lot of questions and helpful tips when it comes to Medicare. There are certain categories of Medicare for which, even if you are not actually actively enrolled, if you are eligible, no marketplace for you. There are other folks who can. So there are good places to get into those details. I don't think this plenary is the best place for it, but I think Cover Wisconsin can point folks in the right direction to those details, because they're incredibly important to make sure that the clients that you're helping are getting to the right place and understanding how their choices affect other members of their household. With that, I wanted to do one last question, and I won't identify the asker, but she does say this is a newbie question, but I actually don't think it is. But it's a good place to end. Do the procrastinators who wait until January 14th at 10:45 at night to submit their application, do these folks tend to be younger? Or what do we know about people who wait until the very last minute? Is there anything we can glean from that as we think about outreach strategies?
I think, yes, they do tend to be younger. They also tend to be healthier. They also tend to be very internet savvy and just think that they can get on healthcare.gov on their cell phone and just take care of it, you know, in between other things that they're doing with their lives. And they're not the ones who use the navigators the most. The ones who need assistance know that they need to schedule it a 1-hour appointment probably with a navigator, and they do it pretty proactively. But we do see the majority higher surge going just through the website mobile access. I'm very interested to see if Rachel, if your market analysis showed anything different or what insight, because that was from previous enrollment periods. And of course, we've been in pandemic. So certainly higher mobile access was more likely when people were not able to leave their homes. And so any other insight I think would be very valuable too.
The survey we did, the work we did, didn't really touch on the timing so much, but what we do know overall, especially about ages, is that we are actually seeing growth overall in enrollment in kind of that middle age category, kind of the pre-Medicare age group. So like the 55 to 64-year-olds is where we're seeing a lot of growth. We're actually, unfortunately, seeing a decrease in enrollment among the younger population. Now, whether that's, you know, they're actively making a decision not to purchase health insurance, or they were, you know, too late to get in, you know, for open enrollment or whatever it might be. But we are seeing that growth at not only the higher age levels, but actually to a certain extent at the higher income level as well. And a lot of that has to do with those subsidies being available. And so we're definitely seeing that in terms of overall enrollment. But there is a population out there of those younger folks to encourage them to get in and use the technology. If they need assisters, obviously they're available, but getting the word out sooner will definitely help with those younger individuals.
Great. I think that's a great place to draw us to a close this morning. But please join me in virtually thanking, get some little, applause bubbles going for our fabulous panel this morning. Couldn't have asked for 3 better folks to get us ready and kick off this wonderful conference. So there they are. Love the applause. Thank you. Thank you, Allison and colleagues, for convening this session. And with that, I will turn it back over to you.
Thank you so much. And yes, thank you to Brenda, Rachel, and Lisa, and of course, Jenny, for being here today, providing this really important information, kicking us off. And yes, thank you also everybody for sticking around just an extra few minutes for this particular session. I wanted to make sure we had time to really give it some space to answer as many questions as we could. There are additional questions that we weren't able to get to. What I would, and we've captured those. I'm listening to them and looking at them. I do think that there's going to be additional sessions that we have later in this conference series where some of these you can ask them again, and those speakers will probably be able to dive into some of those questions with you. And for sure, if still that hasn't happened, the office hours after the conference is a great place to bring those up again. So hold tight on some of those. They're excellent questions. So with that, we're going to take a pause, give you a break, and we'll be back here pretty shortly. We'll be back at 10:45 for our next session. So thank you, everybody, and see you in a few minutes. Welcome back, everybody. It was a short break today. We'll probably have longer breaks in the coming days. But excited to move on to our second session. And I believe we have our full panel. I'm going to invite Shannon Draper, who is a Covering Wisconsin staff member and who is leading the session today. And so we're so pleased to have this full panel, and I'll let Shannon do the introductions.
Good morning. It's so nice to see so many familiar names and faces. Welcome all to the second session of today's conference. This morning, we'd like to welcome Autumn Arnold, John LaPhilliph, Nicholas Hayward, and Rachel Witthoft, who are all members of the Wisconsin Department of Health Services Healthcare Eligibility Policy section and Bureau of Eligibility and Enrollment Policy to share more with us on Medicaid policy related to the public health emergency unwinding and policies for a few special populations, including incarcerated individuals, pregnant persons, and immigrants. So we have a lot of ground to cover this morning. Autumn is going to kick off the presentation, but thank you, team from Wisconsin Department of Health Services. Please take it away.
Great, thank you. So the very first thing I need to do is share my screen. So let me attempt to do that. Sorry to make everybody sit around and wait for that. I think I can do it. And you can tell me if I have not done it properly.
Looks great, Autumn.
Okay, you're seeing the presentation version.
We are seeing the presentation
Awesome.
version.
Thank you, good. We're starting off with a win here. Okay, so welcome everybody, and thanks for joining us today. We're really pleased to have an opportunity to talk with you this morning. As you can see from the agenda here, we plan to pack a ton of information into this session. And so my main job today is really just to keep a very close eye on the time and make sure that we stay on track as we get through both the presentations and the Q&A. We're going to try really hard to stay on time so that we're able to get to all of the critical information that we have here. Now, in the session that we just ended a few minutes ago, Director Olson talked a little bit about unwinding, and I don't want to duplicate that. But before I turn this over to Nick Hayward and let him get into some of the details around of unwinding, I did just want to cover a few high-level points just to kind of level set. And the first one is just to be clear about what we mean when we say unwinding. It really, that term refers to the steps that we and other states are going to take to reestablish our regular eligibility and enrollment and benefits management processes after the federally declared public health emergency ends for COVID-19. And I'm going to just say up front that in this presentation, you will hear us say the acronym PHE about 900 times, because that's what we call it lovingly, the PHE. But we're really talking about that federal COVID-19 public health emergency declaration that so many of our policies are tied to. As many of you know, we've been planning and preparing for some time now for unwinding, but that unwinding process will officially kick off when we know for sure that the federal public health emergency is ending. And again, there was some discussion in the previous session about this, but the feds have promised us that they will give us 60 days notice before the PHE actually ends. And so at this point, the earliest date that we think the PHE could end is January 11th of 2023. And with 60 days notice, that means that around November 11th, if it is in fact ending on January 11th, we would hear around that time in mid-November. It's also possible that November 11th will come and go and we won't hear anything. And if that's the case, we would take a working assumption that the PHE is going to be extended by another 90 days. The other thing I want to cover briefly before we get into the details of unwinding is just to say that we're going to talk a lot about unwinding today, but because you were sitting with a group of policy analysts, we're really going to focus on the policies of unwinding. And we are not going to talk at length about outreach or stakeholder engagement or operational concerns or staffing or texting or the many, many different letters that we've prepared to help members understand what they need to do to maintain coverage. I think it goes without saying that we could pretty easily prepare or fill an entire session with any one of those topics. So we're really going to focus on the policies today. But having said that, we do want to share some of the resources that Lisa mentioned. The first is the Partner Toolkit, which is a well-stocked and frequently updated set of materials and resources with a focus on messaging around unwinding. This is currently the best place for partners to get information about what is happening, when it's happening, and what we need help with in communicating to members. As unwinding starts, it's going to continue to be the best place to be looking. So I really encourage you to think of that as sort of as your North Star of unwinding information. Many of you are also already familiar with our DHS Forward Health Partners inbox, but that will continue to be the place where we encourage our partners to go if they have questions or have needs for additional information around unwinding. And then we have also just set up a new listserv for unwinding updates. And so encourage you to join that listserv if you are interested. So with those introductory notes, I'm going to turn it over to my colleague, Nick Hayward, for more on unwinding. Nick, you want to take it away?
Thank you very much, Autumn. And good morning, everyone. It's a pleasure to be here this morning. So as Autumn mentioned, the unwinding process will consist of unwinding temporary eligibility policies that have been put in place during the public health emergency, or the PHE. So what are those temporary policies? I think the primary policy is that BadgerCare Plus and Medicaid members have maintained continuous eligibility during the public health emergency. And so when we say continuous eligibility, what that means exactly is that any member who is enrolled in BadgerCare Plus or Medicaid on or after March 18th of 2020 will stay enrolled in BadgerCare Plus or Medicaid through the month in which the federal public health emergency ends. Now, during this time of continuous eligibility, a member can move into a better benefit, but cannot move into a lesser benefit. Now, there are some situations in which coverage has been terminated. So for members who have moved out of Wisconsin or have passed away or have requested that their coverage end, we have been terminating their coverage. Otherwise, members are maintaining continuous eligibility. We've also postponed healthcare renewals during the PHE, so renewals will be required again after the public health emergency ends. For populations who typically must pay monthly premium, we have suspended premiums during the public health emergency. And for Medicaid purchase plan members or MAP members, they do not need to meet the work requirement in order to be eligible for MAP during the public health emergency. And the final temporary policy is that presumptive eligibility has been expanded to members who are elderly, blind, or disabled. So presumptive eligibility refers to a streamlined eligibility determination process in which an individual receives temporary eligibility. During normal times, members who are elderly, blind, and disabled cannot gain eligibility via this process, but during the public health emergency, they have and are able to. Next slide. So after the PHE ends, for these members with continuous eligibility, we will maintain their continuous eligibility until we complete a full eligibility redetermination. So that is true even if the member were to report a change during the PHE or during unwinding that would ordinarily make them ineligible for coverage. So for most of these members, this full redetermination will occur at their next renewal. And I will talk more about this in just a couple moments. So when we resume renewals for members, we will be distributing these renewals evenly over a 12-month period, and that is to avoid any renewal bubbles for our income maintenance agencies. The distribution of renewals over 12 months will be based on several criteria. So first, we will be ensuring that all healthcare members within a household have the same renewal date. We will also be ensuring that a member's new renewal date occurs at least 12 months after their application or their most recent renewal. For households that receive both healthcare and food share, To the extent possible, we will be aligning the healthcare renewal date and the food share renewal date. So the purpose of this will be so that members can complete both their healthcare renewal and their food share renewal at the same time. And I like seeing the applause and the thumbs up there, so thank you. And we will also be considering how long it has been since the member's last renewal. So for example, all things being equal, a member who last completed their healthcare renewal 30 months ago will have a renewal sooner than a member who last completed a renewal 20 months ago. For some of our members with continuous eligibility, we are not able to complete a renewal, and that is due to systems limitations. So for these members, their redetermination will occur as an application. So for these members, we will be asking them to reapply for Medicaid prior to the end of the month that follows the month in which the PHE ends, so that we can complete that full eligibility determination. So I want to make sure it's clear how an application differs from a renewal. So when an individual is submitting an application, they essentially need to provide all information from scratch. We need their contact information, all of their eligibility information. That differs from a renewal process in which under a renewal, we have the member's eligibility information. So during a renewal, we simply evaluate that eligibility information and ask the member to report any changes in order to determine whether that member can continue their eligibility. Next slide, please. I do want to discuss some of our Medicaid subprograms and how unwinding will occur for these subprograms. So for our SSI Medicaid members and our foster care Medicaid members, these members will maintain their coverage without going through a redetermination, as long as the member remains eligible for their underlying SSI or continues to receive foster care, adoption assistance, or subsidized guardianship. At the bottom of the slide, you see the list of other subprograms, beginning with Emergency Services Medicaid. For these subprograms, redeterminations will occur during the 12-month unwinding period, but the redeterminations will not occur over the entire 12 months. So for example, using that first subprogram, Emergency Services Medicaid, our plan is to complete redeterminations for these members during a certain 3-month period within that larger 12-month unwinding period. One other note about these subprograms is that eligibility for these programs is handled in a computer system that's separate from handling eligibility for BadgerCare Plus or EBD or BadgerCare Plus members or our Medicaid members who are elderly, blind, or disabled. So the main takeaway here is that, for example, someone with Emergency Services Medicaid, I'm sorry, let me use an example. Someone with SSI Medicaid, if they are in a household with a BadgerCare Plus member, the redeterminations will occur at different times for those two different household members. Next slide, please. So what will happen for new applicants that occur around the time the PHE ends? So if someone applies for BadgerCare Plus or Medicaid and their filing date occurs after the month in which the public health emergency ends, then regular rules around termination of coverage will apply. So for example, assume the PHE will end in January and assume that I apply for BadgerCare Plus with a filing date of February 5th. If I'm determined eligible, then I will receive BadgerCare Plus. But then suppose in April, I report that my income now exceeds the BadgerCare Plus income limit. Given that circumstance, then I will lose my BadgerCare Plus coverage effective April 30th. So this differs from someone that has continuous eligibility. If I have continuous eligibility for BadgerCare Plus, and I report that my income now exceeds the BadgerCare Plus income limit, I will not lose coverage when I report that change. The earliest that I could lose my coverage is at my redetermination. And now I'll turn it over to Autumn to discuss reinstatement of premiums during unwinding.
Yeah, thanks, Nick. So I asked to be the messenger on this one because it's a little tricky because we've been working very recently to adjust some of our plans based on new guidance from our federal partners. And I have just a couple of relatively late breaking updates to share on reinstatement, with the big caveat that we are still working through some of these policies and they are still subject to change. So for MAP premiums, we plan to reinstate premiums for new applicants and existing members at the same time after the end of the PHE. At the very earliest, that would be the first calendar quarter after the PHE ends, but want to note that that may very well may be pushed out a little bit later, just to minimize the number of different things that are happening at the beginning of the unwinding period. The new guidance from CMS that we've been grappling with is that we need to implement premiums at the same time for applicants and members, but also that we can't terminate coverage for existing members for non-payment of premiums until their next renewal after the PHE. So what that means in practice is that these members will maintain their coverage. The existing members with continuous coverage will maintain that coverage no matter what until their next renewal, and they'll be held harmless if they don't pay their premiums, meaning there's no penalty until their renewal. And then even if they have back premiums, unpaid premiums at renewal, there's no penalty. That will differ from how we handle new applicants, who will have a premium obligation from the date that we restart premiums. As a side note, this is how we plan to handle the current suspension of work of the MAP work requirement. Our intention is to align the premium reinstatement along with the MAP work requirement reinstatement. For BadgerCare Plus children whose household income is above 201% and who may have a premium, we plan to do what we've sort of always planned to do, which is to reintroduce premiums for new applicants as of the first calendar quarter after the PHE ends, but not charge premiums of existing members until their next renewal. So as an example, if the PHE were to end in January, anyone who applies on or after April 1st and is in that income bracket would have a premium, and any existing members would not have a premium for BadgerCare Plus children until their next renewal is completed. For BadgerCare Plus childless adults, we are still working out the details of how and when we are going to reintroduce the premiums and the treatment needs question. And I'm sorry we don't have a definitive answer on that today. Want to assure you that we will communicate that information and those decisions once we have them. And again, for all of these, I really want to emphasize that our plans are still subject to change. We are working toward implementing what we just described for premiums, and we will share more information about that as we're able. So Nick, I'm going to turn it back to you. I'm also going to do a time check and say we're pretty close. I'm sorry, I used up a lot of your time. We're pretty close to the end of our allotted time here.
Yeah, sounds good. Thank you, Autumn. So earlier I talked about the temporary policy that enables elderly, blind, or disabled members to obtain coverage via presumptive eligibility. We expect this temporary policy to end after the PHE ends, probably the end of the month in which the PHE ends. So wanted to provide a timeline of immediate events that will occur after the public health emergency ends, whenever that may be. So again, Autumn had said the earliest potential end date of the PHE would be January 11th, 2023. So if the PHE were to end on that date, Wisconsin expects to be notified around November 11th of that PHE end date. So then the next step would be that we would begin notifying members with continuous eligibility in January and February, either of their new renewal date or that they need to reapply by February 28th. And again, that population that needs to reapply by February 28th is that population for which we are not able to complete a renewal. As I mentioned, that presumptive eligibility expansion would end at the end of January. And then again, February 28th would be the earliest that any current member would need to transition from Medicaid or BadgerCare Plus to another form of healthcare coverage. And then the resumption of renewals would begin in March. So the first healthcare renewals would be due March 31st and would continue monthly through February 2024. So with a member who has continuous eligibility, it's possible they could maintain that continuous eligibility until February of 2024 if that date is their assigned renewal date. At this time, I'm teed up to ask this polling question. Shannon, can I go ahead and ask this question?
Yes, please.
Okay. The question is, true or false, coverage for all Medicaid or BadgerCare Plus members, even those who report changes during the PHE or unwinding, will be maintained until they complete a full eligibility redetermination. True or false?
So generally we give folks about a minute to respond. So please respond to the poll that has popped up on your screen. Your participation is important, and it helps us gauge understanding of the presentation as well as do the things we need to do in order to issue everyone continuing education and pre-licensing credits. Please respond to the polling question. Coverage for all Medicaid or BadgerCare Plus members, even those who report changes during the public health emergency or unwinding, will be maintained until they complete a full eligibility redetermination. Mike, I think we can wrap that up now. Great. People did pretty well on this. True. That is the correct answer. Go ahead, Nick, and continue on. Okay, now we're at questions. Wonderful. Well, thank you, Nick. Thank you, Autumn. We'll go through questions now. We do have a few, so I'll read them out loud, and then I'll give you an opportunity to respond. So thank you for everyone who submitted questions. So our first question is, can a person request that their BadgerCare coverage be terminated prior to the end of the public health emergency?
Yes, a person can request that their coverage end during the public health emergency. If a member makes that request, then we end their coverage.
And how would they do that?
The member would need to member would need to request an end to their coverage to their income maintenance agency. And then the income maintenance agency would contact us at DHS to end their coverage.
Great, thanks, Nick. Okay, our next question is, can a consumer use his or her emergency Medicaid for an unrelated health concern, meaning not the original reason they applied for emergency Medicaid, while on this program, meaning, as the program continues, enrollment continues through the PHE?
Shannon, I'm wondering if we could hold that until we get through the part about emergency Medicaid.
Sure, yeah, we
Would
can
be
hold
okay?
that.
I just think there's a lot of background there, and so we might do better if we talk about it a little bit later. Thank you.
That's totally fine. Okay. So the next question is, Nick mentioned that sub-programs like emergency services, Katie Beckett, would be renewed in a 3-month period within the larger unwinding timeline. Does DHS expect to renew all sub-programs within the same 3 months, or will the sub-programs be split up in different 3-month periods?
We will not be handling all sub-programs during the same 3 months. So certain sub-programs may have redeterminations occur during the first 3 months. Another sub-program may have a redetermination occur over the last 2 months of the 12-month unwinding period. So that work will be spread out throughout the 12 months unwinding period. And the primary factor here is that for some of these sub-programs, income maintenance agencies need to do some work as part of this redetermination process. So we are spreading this work out across the 12-month unwinding period in order to help evenly distribute the workload for our income maintenance agencies.
Great, thanks, Nick. And then the final question we'll do in this section is just a little point of clarification, which is, can children have both Medicaid or BadgerCare Plus and commercial insurance at the same time?
I'm going to ask Autumn for a little bit of help with this question.
Yeah. And I'm wondering, John, can you hop on? Do you want to hop on and address that? Because I feel like you're probably in the best position to be able to do that on the fly.
Sure. It depends for Medicaid, Medicaid. For Medicaid, yes, they can have both commercial insurance and Medicaid. Issues come up for those kids that are eligible for CHIP, because then we have to worry about employer-sponsored insurance. That's a problem for eligibility for CHIP.
And John, just to clarify, because people may not know the under the hood stuff here, that when we talk about CHIP, we're talking about kids who are enrolled in BadgerCare Plus, but at higher income levels, right?
Yes.
And I would also maybe add that it's not all commercial insurance, right? There are some very specific rules around what is considered affordable employer-sponsored insurance and what, sort of how much the employer is contributing. And so I think the way I would maybe say it is that there are very specific circumstances in which a child who has employer-sponsored insurance through their family might be prevented from getting BadgerCare Plus. But for many, many children, it doesn't matter whether they have commercial insurance or not. Do you think that's accurate?
Indeed.
Okay, thanks.
Great, thanks. I think that was a really helpful, quick summary of some complex policy around the CHIP program. So for now, we're going to continue on with the presentation because we have lots more to get to, and just know there will be other opportunities to ask additional questions.
Great, thanks, Shannon. So now I'm going to turn it over to Rachel, who's going to talk about some special populations. Rachel.
All right, thanks, Autumn. And can everyone hear me all right? I was having a little problem with my mic. Okay, great, thank you. Yeah, so talking about some other additional populations here. So the first population to talk about is suspension for incarcerated individuals. So these are individuals in jails and prisons. So people who are incarcerated are eligible for suspended BadgerCare Plus or Medicaid if they meet the program rules. So BadgerCare Plus or Medicaid will only pay for services if the member is hospitalized as an inpatient for 24 hours or more. Suspension can be applied both to people who are enrolled prior to incarceration and for people who apply while incarcerated. Suspension will be lifted when the person is released from jail or prison. A new application is not needed in order to lift the suspension, and the person can contact their IM agency to report when they are released from jail or prison. So that's just sort of some basics about suspension for incarcerated individuals. All right, next slide, please. All right, great. All right, the PHE does not impact whether a member's BadgerCare Plus or Medicaid will be suspended. So members will continue to be suspended during the PHE and the unwinding period while they're incarcerated. Suspended members will be part of the general population whose renewals will be spread out over a 12-month period, like Nick had talked about before. Suspended members who are released from jail or prison during the PHE unwinding period will have their suspension lifted. They'll have full benefit BadgerCare Plus or Medicaid until their renewal. So just to get a little bit more into that. So as you can tell, these folks in this population, they do have sort of that continuous coverage requirement, but we still do have to suspend them while they are incarcerated. And that's because the continuous coverage requirement doesn't supersede the limitation on using Medicaid funds for inmates at public institutions. So states are still limited to just doing the covered inpatient services for those people who are incarcerated, even during this PHE period. So that's why we continue to suspend people. We have been and will continue to suspend people during the PHE. All right. So getting into the next population, so the BadgerCare Plus prenatal program. So in accordance with federal law, pregnant people who are incarcerated or are not lawfully present in the US may be eligible for the BadgerCare Plus prenatal program, otherwise might be called the prenatal plan. Under normal program rules, members are eligible for full benefits until the end of the month in which the pregnancy ends. So if somebody's pregnancy ended, October 2nd, they would be eligible through October 31st. Coverage includes services such as prenatal care, doctor and clinic visits, prescription drugs, and labor and delivery. Non-qualifying immigrants are eligible for emergency services until the end of the month of the 60th day after the pregnancy ends. During the PHE, BadgerCare Plus prenatal members will maintain their coverage after pregnancy. And just to get into this a little bit more, going back to what I was talking about earlier with people who are incarcerated. So for BadgerCare Plus prenatal program members who are incarcerated, if the person is still incarcerated after their pregnancy ends, they will move to suspended benefits during this PHE period, because again, we have to suspend benefits for people who are incarcerated. If the person is not incarcerated after their pregnancy ends, then they will move to full benefit coverage as they maintain their coverage during that continuous coverage period. All right, so getting into emergency services, and I'm going to get into this a little bit, but I think John also has more as well too. So in accordance with federal law, BadgerCare Plus or Medicaid emergency services, it's a limited benefit for individuals without a qualifying immigration status. So this benefit only covers medical services needed for the treatment of an emergency medical condition. And emergency medical condition means a medical condition that shows acute symptoms of sufficient severity, such that lack of immediate treatment could result in serious jeopardy to the individual's health, serious impairment to bodily functions, or, oh gosh, I just lost my, so sorry about that. I just lost my notes. I'm sorry, 1 second. I just did something to my computer.
Rachel, while you're looking, I can fill in the last point, which is serious dysfunction of a bodily organ or part. So I think that that's the list that you lost.
Yes, thanks, Autumn. I appreciate that. And I am back back with my notes. And then, so continuing on with this slide. So just to note, there's not a standard list of covered services since coverage is dependent on it being an emergency medical condition. So, of course, there are services that can be provided to people in non-emergency situations and emergency situations. And so this coverage is for those services in emergency situations. All right. So as Nick mentioned earlier, so emergency services is one of the populations that during the PHE, they'll continue to maintain that emergency services coverage. Only medical services needed for the treatment of an emergency medical condition will be covered, like I said, but members won't need to reapply if they have a new emergency during the PHE. So they might have, an initial emergency, and that's what they initially applied for. Because of the continuous coverage, they maintain their emergency services coverage, and then maybe some months later they have another emergency, and so that coverage could be covered under this emergency services without the person needing to apply again for emergency services for that second emergency. And as Nick said earlier, emergency services is one of those populations that will their renewal will be in sort of a 3-month period at some time during that unwinding period. All right, so extension of the postpartum period. So pregnant BadgerCare Plus members continue to be enrolled in BadgerCare Plus until the end of the 60th day after the pregnancy ends. During the PHE, of course, those members will continue to be enrolled due to the continuous coverage policy. But we wanted to say that DHS has submitted an 1115 waiver to CMS to extend the postpartum BadgerCare Plus coverage to the end of the month of the 90th day after the pregnancy. And so adding another month to that coverage. States do not have the option of providing postpartum coverage to the BadgerCare Plus prenatal program members that I had just talked about, except through emergency services. So where I'd mentioned on the previous slide that, for those prenatal program members, they can have emergency services for, till the end of the month of the 60th day after the pregnancy ends. If this, with this change, it would be the end of the month of the 90th day after the pregnancy ends that they could have that emergency services. Again, this is DHS has submitted the waiver to CMS, but we have not yet received approval on this. So this is a possible policy change in the future, but right now the current policy is that 60th day, as it has been for a while. All right, and I think that's all that I had on my section. So yeah.
Great. Thanks so much, Rachel. We do have a few questions. So I'm going to do my best to clarify some of them. So we have a question here that is a little bit detailed. So it's a scenario. So if we have a patient that's a legal citizen and on BadgerCare Plus while being pregnant, but doesn't have a job after they give birth to the baby, what happens with the follow-up appointment at 6 weeks? Would they still be able to be covered under Medicaid, or do they have to get private insurance at that point? So they're asking about, after the birth of the baby, how does this, the BadgerCare Plus prenatal coverage continue?
Shannon,
so maybe we can go back.
Yeah, and before we answer, can I ask, are we talking about someone who's a U.S. citizen and is in normal, or qualifying immigrant is in normal BadgerCare Plus, or are we specifically talking about the BadgerCare Plus prenatal plan that Rachel spoke to?
This scenario specifies a citizen.
Okay. So my suggestion is that, Rachel, could you talk about the coverage for a BadgerCare Plus person in their postpartum period under normal circumstances, and then if Nick needs to, he can add on to what happens during the what is happening right now. Does that work for you guys?
Yeah, sure. So yes, under normal circumstances, like, the PHE doesn't exist, we're under normal program rules. So somebody who's on BadgerCare Plus as a pregnant woman, they would be eligible until the end of the month in which the 60th day after their pregnancy occurs. So if somebody's pregnancy ended on September 28th, let's say, the 60th day would fall in November, and so they would be eligible for BadgerCare Plus till the end of November. At that point, the person, if they meet the BadgerCare Plus rules as a non-pregnant adult, they could continue on with BadgerCare Plus. If they don't meet the program rules for BadgerCare Plus as a non-pregnant adult, then they would lose their BadgerCare Plus coverage at that point. Again, this would be under the normal rules, not the PHE rules.
And given the PHE rules, if that member, again, to continue Rachel's scenario, if that member gives birth today, September 28th, under normal times, their eligibility would end November 30th, but because they have eligibility on or after March 18th of 2020, this member maintains their eligibility past November 30th until they complete a redetermination after the public health emergency ends, whenever that will be.
Great. I think that's a helpful response, laying out a couple of scenarios to in public health emergency times, adds complexity to these questions. So it's always important to maintain that perspective. So this one, back to Rachel. So for members that are released from incarceration and the suspension is lifted, the question is, will they immediately return to their previous HMO or move to, and she wrote FFS, so fee for service, or something else?
Sure, and this really depends, I think, on how long it's been that the person has been on suspended benefits, or if they had previously been in an HMO. So if somebody has only been incarcerated for a short period of time, I apologize, I don't have the numbers in front of me right now, but maybe it's only been a few months or something like that, they generally get moved back to their previous HMO. If it's been a longer period of time, or they were never in an HMO before, then they would go through the sort of the normal HMO enrollment process. That would be appropriate. Of course, if somebody, when they're released, they move to a different area that they used to live in, from prior to when they were incarcerated, of course, the existing rules kick in about people being able to change their HMO perhaps to their new area depending on where they now live.
Great, thank you. And I think we'll do one more question in this section, and then we'll continue on. And if we have time at the end, we'll track back to some of these additional questions which are being asked. We have a number of questions. So this question is about going back to the pregnancy and postpartum questions, and specific to non-public health emergency rules. Would the child who is born be eligible for BadgerCare for a certain period of time? So I think we could clarify if this is a child born to a mom who's on BadgerCare Plus, what the rule is, and then any other differences that you want to lay out.
Sure, so I can take this one. So when the person who gave birth, so when the mother who gave birth was determined eligible, or was eligible for BadgerCare Plus, other full benefit Medicaid programs, emergency services BadgerCare Plus, emergency services Medicaid, or BadgerCare Plus prenatal program, as a non-qualified immigrant, they for any of those programs that the mother was eligible for in the month that they give birth, then the child is eligible as a continuously eligible newborn for BadgerCare Plus until they are 13 months old.
Great. Thanks so much, Rachel.
And Rachel,
Let's
since
continue on. And if we have time, we will track back to some additional questions around pregnancy and postpartum and eligibility.
And Shannon, do you mind if we just quickly touch on, Rachel, can you clarify what happens when the child is born to someone who is incarcerated? Because I think that is different. And I've answered that question correctly before, so I want to make sure we get the right answer out.
Yeah, that's great.
Autumn, I actually want to double check on that just to be sure I'm giving the right information. So I will take a look at that while John's doing his part, and then I can answer that later on just to make sure I have the right answer.
Wonderful. That sounds great. Thank you. Okay, so that brings us to John LaPhilliph, who is going to talk about immigrants and eligibility.
Thanks, Autumn. Hi, everyone. Today, I'm going to cover some basic healthcare eligibility rules concerning immigrants. I'll start with describing eligibility for qualified immigrants and then lawfully present immigrants. Next, I'll briefly go over the verification requirements income maintenance workers must follow before making an immigrant eligible for healthcare benefits. Finally, I'll say a few words about some recent immigrant groups arriving in Wisconsin. Starting with qualified immigrants, certain immigrants are deemed to be qualified for Medicaid and BadgerCare Plus. Some qualified immigrants are only eligible 5 years after receiving their status. These include those who are lawfully admitted for permanent residence, conditional entrants, those paroled for more than 1 year, and those who have been battered or subjected to extreme cruelty. Other qualified immigrants are eligible right away. These are mainly refugees, asylees, those whose deportation has been withheld, and Cuban Haitian entrants. In addition, I want to mention honorably discharged veterans or active duty military personnel, their spouses and minor children can be eligible right away, even if they are in one of the groups that normally has a 5-year wait. I also want to point out that when I say in this presentation that an immigrant is eligible for healthcare, I mean that besides being in a qualified status, the immigrant also meets all the other eligibility requirements for Medicaid and BadgerCare Plus. Next slide, please. Other qualified immigrant groups include American Indians born in Canada, victims of trafficking, special immigrants from Iraq and Afghanistan who worked for the US government, citizens of the Compacts of Free Association, Afghan parolees in 2021, and Ukrainian parolees in 2022. These less common immigrant groups are also eligible without a 5-year wait. And these last 3 groups were added in the last couple of years through federal law changes. And I'll talk about them a little more later. Since 2009, Wisconsin has elected to cover lawfully present immigrants, or children under the age of 19 and pregnant women. These are persons who are not qualified immigrants, but they are lawfully residing in the United States. These include immigrants who are in a qualified status, but have not met the 5-year waiting period. And to point out also that lawfully present immigrants, like qualified immigrants, are eligible for full Medicaid and BadgerCare Plus benefits. Excuse me. Next slide, please. Almost any immigrant who is legally residing in the country is considered lawfully present. This includes persons with temporary protected status and those with student visas. One major exception are individuals with a deferred action for childhood arrival, or DACA status. DACAs are not considered lawfully present for purposes of BadgerCare Plus or Medicaid under federal law. Next. Okay. Verification requirements. So federal law requires states to verify an immigrant's status with the U.S. Citizenship and Immigration Services, USCIS, before making them eligible. This means that IM agencies can't make somebody eligible based on the papers that they may have. Workers must get verification from USCIS through an online system called SAVE for short. Workers are only allowed to seek SAVE verification after the applicant has made a declaration of satisfactory immigration status and provided the IM agencies with an immigration document or a number that they need to use to look them up in the SAVE system. Immigrants who have made a declaration of satisfactory status but have not had their status verified are eligible during a 90-day reasonable opportunity period, or ROP, to either provide documents or wait for SAVE to provide verification. During this ROP, immigrants who are otherwise eligible will receive regular benefits. And just to be clear, a declaration of satisfactory status can be made in writing, signed under a penalty of perjury, or can be made by providing their immigration papers showing their status. Next. As I mentioned earlier, recently passed laws have added several immigrant groups who may now qualify for health care right away. These include citizens of the Compacts of Free Association, or COFA, certain Afghans and Ukrainians. COFA citizens are individuals from the Pacific Island nations of the Federated States of Micronesia, the Republic of the Marshall Islands, and the Republic of Palau. As of December 27th, 2020, COFA citizens are treated as qualified immigrants without a 5-year waiting period. I also wanted to say that COFA citizens can have their immigration status verified through SAVE with just a passport number, because these individuals are in the country under a special agreement with the United States, and as such, are not required to have immigration documents. Next. Now turning to Afghans. When determining eligibility, states must treat certain Afghans and persons who are residing in Afghanistan like refugees. This means they have no 5-year waiting period. This policy applies to individuals who were paroled into the United States between July 31st of 2021 and the end of this month. It applies to Afghans with one of the following statuses: those with a special immigrant visa, special immigrant parolees, conditional permanent residents, and humanitarian parolees. Next. This policy also applies if the person is paroled into the United States after September 30th and is the spouse or child of an individual paroled between July 31st, 2021 and September 30th of 2022, or is the parent or legal guardian of an individual paroled between these dates who is determined to be an unaccompanied child. All of these Afghans will be treated like they are refugees until either March 31st, 2023, or the date their parole status expires, whichever is later. Excuse me again. The latest group of immigrants that Congress has decided to help out are the Ukrainians. When determining eligibility, we must treat certain Ukrainians and others who last resided in Ukraine like refugees. This means they also have no 5-year waiting period. This applies to those who have been paroled into the United States between February 24th, 2022 and September 30th of 2023. Or if they're paroled after September 30th, 2023, and they are the spouse or child of a Ukrainian or the parent or legal guardian of an unaccompanied Ukrainian child who is paroled during this initial period between February and September. Next. The eligible Ukrainians have received the status of humanitarian parolee or regular parolees if they were paroled during the specified dates here. Ukrainians who have not received a humanitarian parole status, but who have a temporary protected status, may also qualify for BadgerCare Plus or Medicaid, but only if they are one of the following: under age 19, pregnant, or their youth under age 21 and residing in an institution for mental disease. Keep in mind, though, that non-pregnant adults with a temporary protected status do not qualify for regular health care benefits. Next. Finally, I want to mention a few things about Cuban Haitian entrants, as we've been seeing a recent increase in the number of Cubans entering the US. We've been seeing Cubans arriving with various immigration papers, but because these individuals have only been in the country a few weeks or months, workers are not getting the immigration status verified by SAVE. So here are a few things to keep in mind. Many Cubans and Haitian nationals are considered Cuban Haitian entrants by USCIS. As such, they are qualified immigrants who are eligible for Medicaid and BadgerCare Plus without a 5-year waiting period. However, as I mentioned before, federal law does not permit our workers to verify Cuban Haitian entrant status based on their documents alone. Cuban Haitian entrant status must still be verified through USCIS and the SAVE system. But even if USCIS can't verify an immigration status right away, if an applicant makes a declaration that they are a Cuban Haitian entrant, they will be granted eligibility during a 90-day reasonable opportunity period while the worker is waiting for that SAVE verification to come through. Next. Well, now we have a polling question to see how many of you managed to stay awake after the first minute of my presentation. So, guess I'll go ahead here. If income eligibility criteria are met, most lawfully present immigrants who are under age 19 or are pregnant are eligible for Medicaid and BadgerCare Plus without a 5-year wait. True or false?
Great, thanks so much, John. If folks could respond to that question. Again, the question is true or false. If income eligibility criteria are met, most lawfully present immigrants who are under age 19 or are pregnant are eligible for Medicaid and BadgerCare Plus without a 5-year wait. So we'll give people just a few more moments on that question. Okay, Mike, why don't you go ahead and wrap it up? Great. And John, how did our attendees do?
They stayed awake. I'm so happy. So yes, the answer is true. Very good.
Wonderful. Thank you all for participating. Now, we have a number of questions. I'm going to say in the next 15 minutes, we are not going to get through them all. So I am sorting through them and going to try to address some of the immigration related most pertinent ones first, and then we may go back to the BadgerCare Plus prenatal program because there remain some lingering questions about that. So our first question that I'd like to put to John is, if someone has a work permit that was obtained through TPS and that and TPS expires, do they lose their coverage?
No, they would not. We do not base our eligibility on their employment authorization. They have a TPS status. We will, as long as they have the TPS status, they would still be eligible. Again, if this is only applicable to pregnant women or children under 19. So if their status changes, well, then we have to see what their new status would be. But as long as they have that, they're okay.
Okay. Thank you. The next question is, does the Am I Eligible tool on the website, on DHS's website, take into consideration all of the immigration details to determine if a person should apply?
I'm afraid you've got me on that. I haven't checked the Am I Eligible site for quite a long time. So I'm sorry, I really just don't know offhand.
Yeah, I can probably take that one and say that, Am I Eligible is really intended to be a high level look at sort of an estimate of whether or not people, might qualify for programs. And so we do not get into details around immigration status there. As you can see from this presentation, we've only dipped our pinky toes into immigration status, and we could talk for another 3 hours on the details of who qualifies and who doesn't. So I would say that if you're working with someone who is not sure, they should always just apply, and based on the details of their circumstances, the income maintenance agency can make a determination. So I think the short answer is no, Am I Eligible doesn't go there, but that if someone appears to be eligible otherwise and Am I Eligible, that it makes sense for them to go ahead and contact their income maintenance agency.
Thanks, Autumn. I think that's useful. Here's a question just about students with visas. And I think, Autumn, maybe you can take this one, is, can students with visas apply for Medicaid?
I cannot take that one. I can say that anyone can apply for Medicaid, and I'll turn it over to John if you can speak a little bit to the students with visas issue.
Sure. Yes, again, anybody can apply. They should go ahead. If they are truly just a student visa, that would be somebody that would fit under the lawfully present category. So they would only be eligible for BadgerCare Medicaid if they were under 19 or pregnant.
Great, thanks. Now I just have a couple questions that I want to address that are just about some terminology used. Can you explain what the SAVE program is that was mentioned in the presentation?
Sure. It's an online portal that the USCIS has so that entitlement agencies working with all the entitlement programs across the country can access it. They put in the person's name and date of birth and their alien registration number, and the system comes back and lets the workers know what is their current immigration status. I can maybe go look up what the acronym stands for, but I don't think it's really going to help anybody with that. So
that's okay. I think that was a helpful explanation of how it's used and why we talk about it a little bit. So thanks, John. And I also put just some additional details in writing in the Q&A if anybody wants, to know a little bit more about it. Okay, so this one mixes immigration eligibility along with the BadgerCare Plus or the prenatal BadgerCare program. So the question is, what document or documents can be provided to consortias by an undocumented woman when a consortia asks for identity verification for the BadgerCare prenatal program?
Okay. Well, basically, if they're undocumented, we do not require any kind of identity verification. We also don't require them to provide a social security number. So the fact that they are undocumented means there are no papers and there's no expectation that they provide any. Pretty much for our program, for healthcare, the need to provide verification of identity is pretty much limited to people needing to prove their United States citizenship. But otherwise, it's not required for eligibility, especially not for prenatals.
And I will tack on that if folks are experiencing issues of people facing barriers to getting BadgerCare Plus prenatal because of requests for identity verification or documentation, that would be an appropriate thing to escalate through the DHS Forward Health Partners inbox.
Thank you, John, and thank you, Autumn. I'll get that DHS Forward Health Partners inbox email into the chat shortly. Here is another immigration related question. So the question is a child with an employment authorization card eligible for BadgerCare as long as they're meeting the other, qualifying criteria such as income?
I think it's a pretty safe bet to say yes. And the reason I'm giving that answer is because for someone to get an employment authorization means they have to be lawfully present in the United States, that they're in one of those categories that's either lawfully present, they may even be a qualified immigrant, but either way, as a child, they would be eligible. But the card alone is not going to be the ticket. They still have to, the worker still has to go and get that verification through the SAVE system from USCIS as to exactly what the immigrant status is. So.
Great. That's very useful context. Thanks, John. We have one here, which is, I think maybe just a point someone wanted to share, which I think is important to this discussion, which is that for many immigrants, when they are in that 5-year waiting period for eligibility for BadgerCare or Medicaid, they apply for health insurance on the marketplace. So for those immigrants who have a legal status, that is a terrific avenue to getting healthcare coverage during what is commonly referred to as that 5-year wait. So thanks for sharing that important perspective. We have another one, which is, can the SAVE system be accessed by a certified application counselor? Can take that one. The answer is no. You can't access that system. You would, do a call to the Consumers Consortia or do the online application, and then it would be done at the state government, or it'd be done at the consortia level, the access to the SAVE system. Is there anything else you wanted to add to that one, John?
No.
Okay. I want to go back to a question that I think Nick is going to take, which is about someone commenting that they have seen folks lose emergency Medicaid during emergency Medicaid coverage during the public health emergency. And Nick, I queued this one up. Do you want to jump for you? I queued this one up for you. Do you want to jump in here?
Yes, thank you, Shannon. So my understanding of the question is that there may have been an instance in which someone had been eligible for emergency services Medicaid during the public health emergency, but then lost their eligibility for emergency services Medicaid during the public health emergency. That loss of eligibility should not happen, because if an individual gains eligibility through emergency services Medicaid during the public health emergency, they maintain continuous coverage through the end of the public health emergency. When emergency services Medicaid is, I guess, is certified, I know that an end date needs to be entered into our system. And so income maintenance agencies have been requested to enter an end date that reflects what we think may be the next possible end date of the public health emergency. But then every time the public health emergency gets extended, then we are requesting income maintenance agencies to update that end date for all emergency services Medicaid members. So again, I can't speak to what happened, but what may have happened is that perhaps that the end date did not get updated properly. I think, as Autumn said earlier, I think this would be an appropriate issue to raise via the DHS Ford Health Partners inbox.
Great, thanks, Nick. Next up, I queued up the audience is very engaged. They're asking lots of questions. We have 3 minutes. I've queued up another question for Rachel to answer. So Rachel, do you want to hop on and address the question around the BadgerCare Plus prenatal program and how long it lasts after the birth of the child?
Sure. Thanks, Shannon. Yes. So I think the question was specifically about somebody who is on the BadgerCare Plus prenatal program due to an undocumented immigration status. So in that situation, so the person's BadgerCare Plus prenatal program eligibility will end the end of the month in which the pregnancy ends. So if the pregnancy ends, September 28th, that coverage would end on September 30th. And again, this is all under normal program rules. So I'm not saying anything as it is under the PHE rules with continuous coverage. But under normal rules, it would end the end of the month. The BadgerCare Plus prenatal program coverage would end the end of the month in which the pregnancy ends. The person could then be eligible for an additional 2 months at this point, 2 months of emergency services coverage after that. But again, that's emergency services coverage and not the prenatal program coverage. So I think that's it for that question. Shannon, just real quick too, I said I would follow up on the earlier question about a child or the baby's coverage for women who are on the prenatal program due to being incarcerated. And I do want to clarify on that one that so children born to incarcerated mothers on the BadgerCare Plus prenatal program, those kids don't automatically gain eligibility as continuously eligible newborns. However, they still could become eligible for BadgerCare Plus under, the normal eligibility criteria for children. So they still could end up with BadgerCare Plus coverage. It just wouldn't be that sort of automatic, continuously eligible newborn pathway that some of the other populations have.
Great. Thanks so much, Rachel. So we're at 12 o'clock. I think we'll take the final question, which was a more general one, just to wrap up today's session, which dealt with a lot of complex policy issues for the state's Medicaid programs. And this is just a question about the public health emergency. And the questioner said, it seems like it will keep going on and on at this point. And this is a little bit of just a crystal ball question that I don't think anyone can answer directly. But just, Autumn, maybe you could speak a little bit to the continuation of the public health emergency and just wrap up with some thoughts about and reminders about how we will know when it ends. And what to expect after we get that communication from the federal government.
Yeah, thanks. Sure, I'd be happy to. And just to say it again, we really don't know what's going to happen. I wish we did. We really don't. And so it's kind of anybody's guess about whether this is something that's going to go on and on, for another year, or if it's something where unwinding actually is nigh and we're going to start pretty soon. We really don't know. What we do know is that if the PHE is in fact going to end in January, that we should know about that by November 11th, and that we are prepared to move very quickly into action with communication to our stakeholders, with communication to members. The first letters will start going out. It's going to hit the media. So, we are taking the January date seriously in the sense that we absolutely are going to be ready for, getting word in November that the thing is going to end in January. But I think we all need to be mentally prepared that, the PHE has been extended 10 or 11 times already. And so, I personally would not be surprised if November comes and goes and we don't hear from the feds. And so then we go through that same exercise 3 months later to say, okay, now, we're going to wait and see if we get notification. So, yeah, I wish I had a better answer than that, but that's kind of where we sit right now.
I think that's helpful. Thank you, Autumn. So thank you all. Thank you, Autumn. Thank you, Nick. Thank you, John. And thank you, Rachel, for your time today. We have lots of questions which we were unable to get to today. And so we will look through those questions and we will do our best to address them in writing and, post answers. We probably will not be able to address all the questions. Sometimes these particular areas of policy get really complicated, but we will at least provide some direction about, who to contact and provide a reference to that Forward Health inbox that was mentioned that I did not get into the chat. So my apologies for that. But thank you, team. I really appreciate your time and sharing so much detail with us today.
And thank you, Shannon. So I see lots of love. Thank you, everybody, for hanging on just a few last minutes there. And as I promised, I'm just going to read the names of those who have the gift card for submitting photos. That's Katie Markart, Sophia O'Donnell, and Teresa Schmidt. We will be reaching out to you sometime probably next week. And then in terms of attendee gift card today, that would be Kay Zilmer. So congratulations, and congratulations speakers and Shannon, wonderful session. Thank you so much. We look forward to seeing you all again tomorrow. Have a great rest of your day. Bye-bye.